Everyone's visible. Thank you very much. So Sandesh, I've already, made you a co-host. So when it comes to your turn of talking, please just maximize your PPT and we'll take you through the process. You can just do the screen share. We're going to share the slides from our own place. So we're going to get going, right? So we are live, guys. We're also live on YouTube. Okay. Just give me a moment. So you see me leaning here, leaning there, because I've got like a setup over here, so don't get a little flummox. First of all, great afternoon. Thank you very much for coming by. And we have a very awesome panel today, ladies and gentlemen. Thank you very much for sparing your time. I'm amongst friends and family. And I extend a very hearty welcome on behalf of all of us to those of you who have logged in on YouTube and those of you who are with us on Zoom. I'd urge all of you to please stick on and listen to all the wonderful panelists who've so kindly consented to come here and share their knowledge in a crisp and timely fashion. We're all locked down. I presume we're all confined, but we're all fine. We are luckily not wearing our masks, and online, this is the biggest advantage, that we cannot experience one of the biggest problems that all of us face, which is bad breath, and of course, a lot worse than that. Now, many of us hesitate in telling each other that we have issues, and we have issues related to the oral cavity. As such, there's a great joke amongst all the medical professionals that those who didn't get for medicine end up taking dentistry. I beg to differ. I'm one of those few who actually took it as a first preference. I believe that every field of specialty deserves its own merit and its own position. And I'm glad that all of us with lots of experience and most of us who look very young are just sitting here and looking good and ready to share. So ladies and gentlemen, this session and the entire aim for a second, which I'm going to explain, is the fact that we all gather together so that there is some awareness in the public about different forms of health and different forms of wellness. We try and touch upon some of the common ailments and illnesses, but we don't prescribe online. But yes, the panel of doctors that have come online so far in about 5 to 6 sessions, which we've had before, are tremendously appreciated. We had lots of emails. We have lots of people who keep asking us, when is the next panel coming on? So my heartfelt gratitude to everyone who comes by. The downside of offering something for free, however, is that people think that we have nothing better to do. On that note, I would say, let them think whatever. Before I start this program, I'd like to express my gratitude to my dear, dear friend and somebody who helps me on the back end. That is Dr. Jagdish. Dr. Jagdish Gandla is based in Germany. And I'm very sorry to tell all of us that his father passed away last night. And in spite of that, he's sitting here on screen. And his mother is also having COVID. His whole family, both sisters, they're all admitted, they're all having COVID. And Jagdish is in Munich and Jagdish is in Germany. He's logged in here, but yes, he's busy taking care of the formalities. And he's given me full charge of the technology. So my apologies in case something goes right or wrong. Remember, I'm a doctor. I'm doing my best with probably a different kind of practice today. So we'll do our best. Moving on straight to the topic, we cut all the frills in these kind of conversations. We are talking about different aspects of the oral health today. We're talking about different aspects of teeth and the soft tissues inside your mouth, to be very precise. But I'm going to start with a doctor who is so kindly obliged to be here. And this is how the session runs before I begin. Everyone comes and speaks for about 15 minutes, after which we have a Q&A. And once we have a Q&A, then probably you can start keying in either on YouTube or on the Zoom room so that we can address the questions to the concerned panelists. The first person to come in here and to start her conversation is somebody who I think is heading a department, which is a multi-speciality hospital at Kottayam in Kerala. She's in Changanasheri, a place very near Kottayam. Now, from my friends who are in naturopathy, in the stream of naturopathy, they've told me very clearly that she's extremely intelligent, very dynamic, and means very, very well. Ladies and gentlemen, to a lady who is so humble that even before I just called her once, she said, yes, I'm ready to do whatever you ask me to. I love sharing in the interest of people and patients. So for a woman who's heading the department, having done tremendous work, lots of research, and coming ahead to share with us what she thinks is the naturopathic remedy to bad breath, which is one of the most common problems which people don't even speak about, and bleeding gums. Fellow friends, panelists, and everyone else on YouTube, let's, with a big smile and a thumbs up that you can send online, welcome our first speaker for the day, Dr. Abhirami Prakash. Abhirami, the screen is all yours.
Thank you, Dr. Ushi. Thanks for the introduction. So, a very good evening to everybody. So, we are into the topic as we don't have much time for introduction and all those things. We just go straight into it because we have 15 minutes, and in this 15 minutes, today we are going to look at a very common oral health issue, that is bad breath and bleeding gums. So even before you start going to a dentist, like even before you think of a dentist, the first thing oral health issue is the people who is around you. So there is somebody who is very intimate to you. So they are going to tell you, you have a bad breath. Maybe you have to take care. So that is in itself causes lots of psychological issues, like we feel, oh my god, what is wrong with me, your self-esteem may come down. So all these things are makes this a problem, bad breath, a big problem. Though we think it is as a small problem, 80% of the people in the world at some point of their life have experienced this bad breath. Okay, so when we see the bad breath and bleeding gum, we come to the cause, because naturopathy is something that we go into a base of the root cause of the problem of any disease. Like when a person comes, we go into what's really happening and what could be the cause. So to this, if you see the cause, it's bacteria. So when we say bacteria, we have to understand that we live with millions of microorganisms inside us, right? Inside us and even outside us. There is bacteria, virus, and some are harmful, some are very beneficial. You can't say that all bacteria are bad. There are good bacteria and there are bad bacteria. So in that condition, there are lots of bad bacteria that could cause infection and inflammation in any organ they stick onto. Okay, so that is the reason when these bacteria accumulate in your oral cavity, in your tongue and teeth, it is going to cause lots of problem, from bleeding gums to the bad breath, and lots of cavities and all the dental caries. Everything is associated with this bacteria. Okay, so now how these bacteria come into us? So we all know that we have lots different kind of food, not one kind of food. We have so many types of different kind of food, different timings, and each culture has different. That is, we have so much different kind of food. Not everybody has same kind. So these food particles, when they get digested in our mouth, when they get broken down into smaller particles, it has lots of end products. Like every starch becomes glucose and proteins become amino acids. So each nutrient breaks into smaller particles. So these smaller particles, the end products, when it is in unfavorable condition, so it becomes a bad bacteria that can cause lots of illness, that can cause lots of problems to the teeth and also to the gums. So these food we have to avoid. So we are going to see that in management. First, we'll see the cause. So second thing is saliva. We take it for granted, right? Saliva, we don't give much thought. But the thing is, the pH of saliva, it's supposed to be 6.2 to 7.6. When the pH of saliva becomes very, very acidic, or when there is dry mouth, you don't have enough saliva, it can be a very, very good breeding place for bacteria. This you would have experienced every day without a knowledge. Every day, as soon as you get up in the morning, you're going to have a morning breath which is going to smell very bad. The reason is the whole night we are going to keep our mouth shut. Unless we are into a late night conversation, we are going to keep our mouth shut. So that leads to lack of movement, and the lack of movement causes very less salivary secretion. And when there is very less salivary secretion, it's going to cause lots of bacteria to accumulate, and that causes the morning breath to be very, very bad. So in this slide, you can see whatever the causes that is going to decrease our salivary secretion and is going to increase our bacterial accumulation. Okay. And third thing is alcohol and smoking. Anyone, any dentist or any layman knows that whenever a person smokes or whenever a person consumes alcohol, he is going to have a oral health issue. It's not just liver or cardiac problem. He is going to have, the first thing that he's going to experience is his oral hygiene is going to be compromised. Okay. The reason is whenever a person consumes alcohol, the mouth is going to be dry mouth, and alcohol is going to be make the saliva more acidic. And especially when it is mixed with the carbonated drinks, it is going to further adding to the problem, which makes a saliva more acidic, and more acidic, more prone to bacterial infection. And more bacteria, we are going to get more bad breath and bleeding gums. And next one is stress. Why stress here is, there are lots of researchers which says that a person who is having lots of stress has lots of tongue coating, the tongue coating. So the tongue, another thing we have to concentrate is, our tongue has a rough surface. It doesn't look as smooth as you see. It has a rough surface. So in the rough surface, the food residues or debris, when it gets thick, and there is a lot of chance of bacterial accumulation in the tongue, especially in the tongue. If we don't go for proper oral hygiene, like tongue scraping or something, so we are going to end up there is chance of lots of bacteria to be entered in the tongue. So what happens is, when there is stress, it has been researched that the women who has lots of stress, the coating in the tongue is very, very thick. So that means that whenever there is, you are stressed, there is going to be cortisol, noradrenaline, and the whole hormone firecrackers is going to blast everywhere in the organ, and it is going to affect every system in your body. It could be cardiac system, it could be digestive, it could be anything. So it could be acute stress or a chronic stress. And when that happens, what happens is the immune system is compromised. The same thing we can see even in COVID. COVID is a bigger problem, but this bacteria is smaller problem. But still, whenever there is when we compromise the immunity because of stress or any reason, there is always a chance for any mild bacteria to get into a bigger screen and cause problem. Your bacteria may be harmless, but when your immunity is very less, you are prone to any kind of bacterial infection. So that is another reason for repeated bad breath and bleeding. And this is all oral causes of what happens in your mouth. And there are so many non-oral causes, which is not exactly into the mouth, but there are other systems, what's happening. So first thing is, if you have a sinusitis, bacterial sinusitis. So whenever there are lots of people who doesn't have any problem of their oral cavity, but they do have chronic sinusitis, they also have a chance of developing bad breath. And the bacteria has a chance of invading the gums. And second thing is acidity. We don't think of acidity as a oral health problem, but whenever a person has acidity for a prolonged duration, there is always a chance for bad breath. And third thing is liver failure. So you may be knowing that liver is a detoxing organ in our body. So whenever there is a detox, whenever there is not happening, a proper detox is not happening in the liver, there is always going to be a problem in our mouth that is going to be reflected. So all these non-oral causes also should be considered. Not only this, there are lots of nutritional deficiencies. Vitamin C deficiency could cause scurvy, which will cause again a bleeding gum. Vitamin K deficiency, all these should be evaluated properly. So your first line of defense is always a dentist. Like immediately 80% of the bleeding gum and bad breath has the reason of oral cavity. So first thing, you're going to a dentist and you're going for all the procedures to cover the caries and all those things. And still, if your bad breath persists, then you are going for other procedures and to diagnose whether you have a non-oral cause. Okay. So all these goes with cause and symptoms and everything. So how do we manage? So first thing, as soon as we have bad breath, we confirm ourselves that are we doing our oral hygiene properly. This is very, very important. Though we think we do, but most of the time because of our negligence, we may be missing. For example, brushing twice a day, flossing once a day, and tongue scraping. Most of them doesn't do. As soon as I got this oral health, I was doing a small checkup with my friends and family whether they do tongue scrapping, and many didn't do. So this could be a very, very small reason, but we would have taken for granted. But tongue scrapping and removing the bacteria from your tongue is very, very necessary. Second thing is water drinking. This looks as simple as that, but this is not simple. Water, it's not, no, not everybody drinks enough quantity of water. For example, you are in your office in a whole day, you are into a severe work mode or something. After 6 hours of not communicating with anybody, immediately open your mouth for a meeting, you will have bad breath because of the accumulated bacteria. So what you are supposed to do is have a water bottle in your table and few few drink some water once in a while, and this is very, very necessary. Yes, simple bad breath can be totally eliminated by just a simple remedy like water drinking. It's very, very important. And the next one is eating a crunchy food or chewing a sugarless gum. I told you that more the salivary secretion in our mouth, more the chance of bacteria to be flushed out so that we don't have any problem for the teeth or the gums, right? So to increase the salivary secretion, what you have to do is you have to go for crunchy diets. Crunchy in the sense it's not like chips or something. You're into a carrot or a pear or apple, something like that, which has a thick pectin coating. So when you crunch it, it increases the salivary secretion. Or you can go for sugarless gums, which will again do the same purpose. These two are very, very important because most of the time there are other causes like xerostomia, or there are some medication which will make your mouth dry. So this to reduce this dry mouth, all these are very, very necessary. And next one is mouthwashes. As soon as we tell the mouthwash, we think of lots of color fluid in the bottles, right? That all works. But the thing is, first line, what you can do is you can boil water, just add half teaspoon of salt and allow it to cool till it becomes lukewarm. Just rinse your mouth with water. This is the first and cheapest way of mouthwash because this will help you in disinfecting and throwing most of the bacteria outside your mouth. Every day after brushing or before bed, if you have this habit of salt rinsing, it's very, very helpful for oral health and hygiene. This you can keep it as one of your a part of your oral health routine. And third thing is the diet. So when we say that junk food, we think mainly for the weight, right? We think about cholesterol levels, we think about cardiac health, we think about gut health, but we never think about oral health. We associate oral health only with the candies, right? No, not the candies are not the only thing. There are so many starches in the sense carbohydrates. There are two types. One that is rapidly digestible starch, that is all the junk food, refined sugar, all those things which can be cooked fast, gets digested fast. Any fast food that gets digested fast and it becomes a sugar in 20 minutes. That's like a quick noodles. It becomes a simple sugar very fastly, and that's going to be very harmful for the teeth. But at the same time, there are slowly digestible starches. So that has a whole wheat bread, or it's a rice with rich fiber and many vegetables, meat. All these things will help in digesting the food very slowly. It takes 60 to 120 minutes. So those are the things which doesn't cause any problem to your oral health. Okay, so these health is very, very important, taking care of your diet and de-stressing. One of the reason stress is important is whenever a patient is in depression, anxiety, we have seen lots of people, they neglect their oral health. Though we treat them in all the way, there is always their personal hygiene will be neglected to the larger extent, especially in bipolar disorder and in other psychiatric disorder. In those conditions, this negligence can cause a lot of problem in oral health. So that also should be taken care. So in naturopathic view, we don't see oral health only as oral health. It's everything. Like we treat a person as a whole. So when we talk to them, we go for a complete detox. It starts from their gut. We concentrate on diet. We concentrate on the good fat and bad fat they eat, on the alkaline diet, which is very, very useful to reduce the pH of saliva. And all these things come into picture. And finally, it ends with de-stressing. So when the person is stressed, whatever the treatment we are going to give is not going to be working for him. So the stress, increasing the immunity. So it is all into a multi-level of management. So a complete detox will help in throwing up this bacteria and all these germs. The toothpaste advertisement, you can see all the computer graphics, color, red color, all the kids to attract the kids to brush. They keep all these bacteria, and all these are true, and these bacteria are the culprit. So I think more than the adults, I think this information should be passed on to the kids so that they form a develop new and good oral routine so that they don't end up in a dentist office. So that is what we naturopathy do. We prevent it before it happens. All this saltwater rinsing, some herbal mouthwashes with lemongrass, essential oils, all these we are doing to prevent it. So once it comes, obviously you have to visit a dentist, and that is the next thing. So this is what we wanted to address, and this is the thing that I wanted to tell today on naturopathic view on bad breath and bleeding gums. So thank you,
Thank
Dr.
you.
Vishil.
Thank you. Yes. Thank you, Dr. Abhirami. And
Thank
yes,
you.
those were wonderful tips. I'm sure a lot of takeaways are there. We can see a lot of our listeners on YouTube asking us questions. So I'll save it for probably the end of the session.
Okay.
So what I gathered is, we need to, scrape our tongue, and we also need to have crunchy foods and sugarless
Yeah.
carbs. So I guess, common man has got good access to all of this, and I'm sure that there will be great takeaways. For the benefit of all the people who are telling me where are the slides, we are trying to minimize the use of slides. But for those of the people who are using slides, yes, you will see the slides. So I leave it to the choice of the speakers. Thank you. Moving on, the next speaker on our esteemed panel is somebody who needs no introduction. However, for those of you from the other fraternity and for the general public who really wouldn't know him, he's been a dear friend to me. And one statement he made to me always sticks in my mind. By the way, I fight a lot of the corrupt people. And you know what he said? If somebody has to be your friend, he needs to be a good man. It's not possible otherwise. And this was years ago. And somehow it's stuck in my brain. And I always believe that when nobody is a friend to me, I believe that they've got something to hide. A gentleman who's been very vocal, believe me, we sit with mom and dad and our friends, and we might go maximum up to a level of a chief guest maybe. But this gentleman, he hobnobs and he holds hands and dances around with the likes of Aishwarya Rai and Amitabh Bachchan and Sushmita Sen and God help. So I guess all the people who are beautiful, all the people who are celebrities, all the people starting from sports stars to the Miss Universe, if they are looking so good on screen, minus their clothes and plus their smiles, there's only one man who's done that job. And that is Dr. Sandesh Miker. He runs a huge practice in Bombay, a hot favorite amongst a lot of people. A lot of people refer to him with fondest of love. Ladies and gentlemen, with lots of gratitude, I welcome our next speaker, who's been awarded the father of modern dentistry. Imagine, I dare not ask who the mother is. I'm sure he'll come in and crack a joke or two. As far as I know him, Sandesh is a humorist, very humble, grounded person. And by the way, ladies and gentlemen, if you're looking at him smiling now, he's just finished suffering from COVID, but he hasn't really suffered. He's actually come out of it smiling. He's taking a lot of sessions. The other day, he was in a session with Madhavan and Rajkumar Rao. teaching people how to smile your way through COVID. So without any delay, let's welcome our next speaker, my dear friend, Dr. Sandesh Miker. The screen is all yours, Sandesh.
Thank you. And well, this smile, because I've changed the terminology, fight with COVID, I say smile with COVID. And that's what is my terminology, smile with COVID. And I've gone through that. Anyway, that session is different. I'll straight away go to my presentation on slides, because a smile can't be explained. You can tell about the smile. So before I start the smile, smile is not only morphology. Smile is not only pink and white. Smile is beyond pink and white. As we say that we smile when we are happy, that is called as a happy smile. When you smile, when you go for an exam and the examiner asks question, as a student we smile, but that's a nervous smile. And when we go for condolence, we smile, that's a sad smile. Whereas the morphology remains the same. So smile is morphopsychology. And today with the mask, people can't see the smile. I say, no, you can see the smile, because smile is a curvature. And if you join both the ends of the curvature, they pass through the eyes. So eyes will tell you whether you're confident and you're smiling or not inside the mask. So smile is very important. And remember, smile is morphopsychology. Let me go on to my slides. I have my slides. Just check whether my slides are visible or not.
Please click on, yes.
Visible, right?
Yes, visible. Thank you.
Okay, we say challenging cases. That's the smile which I want to say. Imagine this girl. Imagine this broken
Sandesh,
face.
we can't see it right now. Have you projected your slide? Have you clicked on it? We could see it.
This you can see?
No, you can't. So
Okay,
please maximize your slide. Yeah, now we can just go to next. Maximize your slide first and then screen share, please. Yeah.
Now check it up. I'm showing you. Is that the slide? Can you see now?
Yes, please. Now just do next. Yeah. Maximize it. Just maximize it. Maximize your PPT.
Do this. Can you see now?
That's right. We can. Go ahead, please. Go ahead.
Okay. So these are the different cases. You can see a broken tooth, and I'm going to go through these cases and explain to you what one can do in this type of cases in a short way. As the audience is, I just want to show before, after, and explain to them about the smiles, what we face. So these are the books which I have written these are the books which I have written. One is in English and one is in Marathi. So what happened?
You are, just go to the next slide. Just go to
I've
the
gone
next
to the
slide.
next slide. It's not coming up. It's gone blank.
Okay, so you need to maximize.
I maximize it. Can you see the slide now?
No, you need to screen share. You need to screen share. Are you sharing your screen? Click on screen share, please.
One sec.
And just use your keyboard to go to the next once you share screen. Bottom press on share screen, please.
I did that. The screen was visible. One sec. You can't see now also, no?
No, we can't. You need to maximize and share screen, please, from your side. We could see it, but then it went because the share screen has to be pressed once it's maximized. Have you pressed the share screen?
This way, I did spread the share screen and it came out.
Once again, please. Once again. Bottom, green color button.
Where's my slide gone now? Yeah. Can you see the slide?
No, you can't unless you press share screen. Yes, now we can. Please just use the up and down arrow now. Sandesh, don't touch anything else. Use the keyboard, please. Use the keyboard.
This is okay?
Yeah, this is okay. Now don't touch the green button. Just please do up and down. Yeah.
Okay. Well, I was going for the full screen, but I think full screen is not coming.
Yeah. Go ahead.
Okay, fine.
Yeah.
So, well, any dentist first has to do what we call as CRP, Master in the Clinical Dentistry. First is diagnosis, which is very important. Then comes the plan and then comes the treatment. But many dentists straight away jump to the treatment because patients want something, As you see the treatment plan, patients want something to do. And they just, without diagnosis, they jump into the treatment. That's not the correct way. Any patient should ask the doctor what's the diagnosis and what's the plan before they actually touch your teeth. The second type of dentists or doctors are who do what is according to their knowledge. So you should also understand the knowledge of a person whom you are going and getting yourself treated. But the best doctor does what is necessary for the patient because that's what the patient has come for, because that was the problem the patient was having. So that's what it is. The smiles we talked, there are 3 types of smiles. One is designer or aesthetic smile. As you see the designer clothes of this girl, and you can see in this designer's clothes, she looks beautiful, but same design can't go to some other actress. So similarly, if you see this smile, these are the teeth which are laminates, they merge with the face, and that's we call as an aesthetic smile or designer smile. Or then you have an attractive smile. And when you talk about attractive smile, this is attractive smile. When one tooth is little in and out, but they look attractive. You know, when you look at 10 people and suddenly one person attracts, maybe his dress, makeup, whatever it is, or the smile. So that's called attractive smile, little hutke, little different. And that's we call as attractive smile. And then we have what is called as a cosmetic smile. There are a lot of Hollywood people want straight white teeth. So we give them straight white teeth. As you see a makeup of this, and there's a second type of cosmetic smile. As you see the makeup of this man who danced, and then after the act is over, they remove the makeup. Similarly, one can do a cosmetic smile or cosmetic dentistry to an actor for a particular movie, and after the act is over, they can just remove the whatever prosthesis we are given. So that's the way we define 3 types of smile: is aesthetic smile, that is designer smile, attractive smile, and cosmetic smile. So as a patient, you should be very clear with the doctor what exactly you want. Now, these are the few cases when there are discolored teeth. You can see the discolored teeth before and after. A tetracycline, nowadays you don't find so many discolored teeth because tetracycline is stopped. If you give tetracycline at a younger age, that's when you are 1-2 years old, that time you get these permanent teeth which are stained. But we can do this stained teeth, and this is what we have done. This is what we do before and after. So that is changing the color of the teeth by plain composite material. This can be done in 1 day or 2 days time. So here the material used is bonding and light cure composite. That's what we say. We don't damage the tooth. We just remove a little bit part of the tooth so that the thickness of your teeth doesn't increase. And we add our composite where we mask the color and give the nice white color. But today we do something else. This is what our old cases we did. Now, this is the case supermodel who came to us. You can see the smile here is Gummy Smile, and you can see small teeth here. And they wanted in 4 weeks that Gummy Smile should go. And this is what we did. We did treat the gums, make them pink, but that pink gums usually remain for about 10 months to 11 months. This girl said, I don't mind because I want pink, because she was going to New York for a supermodel. But you can see from this composite that color has changed after 8 years. That's the deterioration of the material. So friends, no artificial things for life stays for lifelong. If you go to a dentist and tell him that I want certain things for lifelong, nothing stays for lifelong. Even your natural teeth are not lifelong, they wear and tear. So you have to replace. So that's the way one has to do this. So this is what we did. But after that, once she became a model, supermodel in 2011, we replaced her teeth with ceramic laminates, and you can see a smile, which is a very, very beautiful smile. So that's what we did with her. But while see another case where the gums were very small, this girl stays in our Suje's city of Dubai. She's from Dubai, as you can see her teeth gums were too grown on the tooth surface. We did the laser where we removed a little bit of gums and exposed the teeth. And this is a laminate done about 14 years back. And this is now last year she came down. So everything remains, this is remained for 14 years. What we did was just remove a little bit of excess gums, and then we did the laminate, and she's very happy with these laminates. So this is what we did for her. This is another case before and after. This actor didn't like this white smile. So white doesn't mean nice. The white looks too big. So we went into a little bit of yellowish shade, and we changed his smile from this. You know, this was before changing the smile. We were doing some trials on the teeth, how to make the teeth look small. So we used pink color material to make the tooth little small. We gave some colors inside, and his father was with me in the clinic. And he said, Doc, you are doing some characters. I said, yeah, I think that's the new word I learned from you, is doing characters. We did the braces treatment. We pushed the lower teeth in. We got the upper teeth in, changed the color, did the gums, a little bit of gum surgery to expose the tooth and reduce the Gummy Smile. And this is what we did. This is the retainer inside. The orthodontist will tell you. And this is before and after. This is what we got for this particular patient. This is before, after, before, after. So one can do a lot of things to change the smile of a person. So this was a smile, his smile. The smile curvature should go according to the lips, but he had some problem in the lips. So we taught her to open the smile, open the mouth and smile so that the curvature doesn't match with the lips. So he opens the smile and he opens the mouth and smile. So that's the way we do it. I'm sorry, actually one by one slides usually come, but here I have to go into all the slides together. Usha, can I try one by one slide? If you can check it. Can you see now?
Yes, we can.
Yeah. So this is where you see a gummy smile. She came in month of June. Her husband, fiancé, was from London, and he said, I don't like a gummy smile. So we said, okay. So we followed the same philosophy what we did for Ujjwala Raut, and this is what we gave her. We did the gum part of it, and then we gave her a laminate. So this was before and this was after, so one can get this type of smile. So this is what we gave it to this girl. So while giving this, every doctor will see the zenith, what do you say, the curvature of the gums. This is very important. And every doctor will also see that if the gums has to go down, the little bit surgery has to be done. So this was a before. I just go a little fast. This was before and after. This is before, after, and this is what we gave it before and after to her. So friends, these are the smiles one can give, and this is why they remain for 8-10 years. But before we give this gummy smile, we always do a mock-up. This girl wanted to, that gummy smile has to be a little less, and we gave her a mock-up. We just made a measurement and just showed her in the mouth that how she is going to look like, and then we proceed further. So this mock-up is necessary for patient to understand how they are going to look. Nowadays, people do digital smile, but this is on the computer. But here we actually show in the patient's mouth, and that is called mock-up. This is what a gummy smile is. We use this material, and we have reduced the gummy smile. Can you see here? So the tooth has become big. So we have to tell her that we have to take the gums up, and then we make the laminates. So a smile will look better than previous gummy smile. So this mock-up, dentist usually does it, and that's what we do. Now this is Miss India. One of the Miss India was going for Miss World, I suppose. So can you see the midline of the nose, midline of the lips, some not matching? And I could not do anything in 10 days time or 15 days time. So on the teeth, I tried to do something which is absolutely cosmetic. The reason being that the floss will not pass. All these teeth are bonded to each other. This is normally we don't do, but this is only for the act that she is going to Miss Universe. And she wanted to smile better. So you can see the midline was shifted. So we tried to get the midline. We reduced the height here, but we tried to get the midline so that she looks beautiful for the particular act. She has to go in for ortho after she comes back. And that's what the treatment we give is momentary. That is called theatrical cosmetic dentistry. So this we call as a Miss India cosmetic dentistry. Now here is the crooked teeth, and she was getting married. 4 teeth. She said, I want these 4 teeth to be done. I said, braces. She said, no. So I said, okay, let me do a mock-up and see how much damage I will be doing to your teeth. If there's no damage, not much damage, I will do it. So this was a smile. What we did was we take the measurements of her teeth and did a wax mock-up. So the minimum reduction of the teeth, you can see from nose position, how the teeth before and after they are going to look like with the wax. Then we took the measurement of this wax mock-up and put a material, which is a temporary material. And that's what material, this is the material in the impression. We hold the impression and we gave this smile. She would like the smile. So these are the cases where she said, I really don't have time and my photographs are very important for marriage. Actually, she should have gone for braces, but we went and got ahead with this particular, these are the mock-ups. So this is what only 4 teeth. We didn't change a bite, nothing was changed. And this is what we gave her. So this is what the smile one can give. Now, this is a girl who wanted to go in for Bollywood. And you can see a smile. This is a before smile. And she said that I want laminates. I looked at her, looked at her eyes, and she was not smiling. She was having headache, etc. So I said, no, we will go in for braces. We opened, this is before and this is after. This was a deep bite problem. We opened the bite, and with only ortho, headache gone and no laminates were done. So any case, when you see young children, young Teenagers, if you see there's a trauma, she's just 21 years old when she came to me. A trauma in the lower teeth, no cosmetic, no veneers. They have to go in for braces to open the bite. And then if necessary, we can go in for veneers. Similarly, a 40 years old, she came for smile designing and we said, no, go in for ortho first. We opened the bite and then we did cosmetics. So it's a combination of ortho aesthetics. This was temporary. And then we did ceramic laminates for her. Her headache is gone and she's smiling for last maybe 4 years. Now this girl, if you see, she's not smiling. She looked tired. She again came for smile design. You can see the tooth was fractured. And this fractured tooth was not due to accident. You can see her bite. You can see her neck. Her neck has come forward. And you can see, because Ushi, are talking to me?
Not at all, not at all. It's
Okay.
someone else. Please keep your microphones on mute.
People were touching
Yes.
the upper front teeth, and that's the reason she got trauma. So this is what was happening to her when she was closing her mouth, the front teeth. When she was closing her mouth, the front teeth were touching. Let me show you this picture. One sec. Now this is what happened in some cases when they close the mouth, the front teeth are touching and the jaw goes behind. And in this case we can't do smile design quick fix. We can't do the quick fix because again, when we do the laminate, they will touch and they will break my laminate. So we told her to go back to London. She was from London. So we told her go back to London, do deprogramming of the muscles, which your last speaker is going to speak on. And then we go in for laminates if necessary after braces treatment. So even you can see 26 years old, all this trauma is not due to anything but the bite problems. So that's called function. Now you can see this case, in her case, 49 years old, the teeth has totally shifted and you can see the teeth shifted. We still do the braces, and after the braces, we gave a little bit of cosmetic touch by doing a pink composite. Can you see a pink color to get the bilateral symmetry? Look at her eyes. She was not smiling when her teeth were not good, and look at her eyes now. So this is the confidence we can see inside the mask when we are having COVID just now. Now this is a case where over ortho was done. What is say one teeth were extracted. So we had to redo the ortho, open the bite, and then we did the cosmetic work. I can't show a picture, but you can see the hairstyle also has changed. She was very happy. So we redid it. And here I would like to tell you one thing, that if anybody having crowding, we can't just remove the teeth and push it in, because what will happen to the tongue will go behind and somebody will get sleep apnea problems. So orthodontists usually open it up. So orthodontists usually see the size of the tongue before they wish to push the teeth inside. So this is a very important aspect a patient should know, that why orthodontist is not going to do the treatment by pushing it in, or what he wants to do it. So here is another case that you look at him, he looks poor, but he's not poor as far as his priorities are concerned. Only one tooth was missing. We did the braces treatment, got it closer. Can you see the one tooth? And then we replaced it by doing an implant. So he wanted the fixed teeth. So we went to all the aspects of dentistry and gave him a good smile. 67 years old lady, and she wanted the teeth to be corrected. You know, many people say extraction, implant, this, that. No, we went into ortho. Your next speaker is going to speak more about adult ortho. So here is the smile designing. Smile designing means as much as possible natural, and design the smile. If natural is not possible, then you go for the cosmetic, what we say, laminate veneers, or combination of the stuff we can do. Now, this is very interesting case. 22 years ago, I got a call on Sunday morning from our friend, Vijay Lakshmi Acharya's patient. She said, Sandesh, somebody is having this problem. She broke her tooth at Friday night, and Saturday morning, she came to me like this. I said, where is the tooth? That piece of the tooth. She said, it's in a different area. I said, go and get it, put it in the milk or put it in the water. She got that piece here. And friends, we just bonded that piece, and you can see the smile today. It's about 5 years and she's still having it. So we bonded with a special material, CNB bond, and you can see that tooth is bonded and still there. Luckily, no root canal, nothing, and she's fine. She comes every 6 months for checkup. And the last case, well, this is a full mouth case, discolored tooth, and you can see missing teeth. You can see milk teeth. This is before and after. And you can see that we removed the teeth. We did braces treatment. We did laminate veneers. You can see the side view. The midline is shifted. The midline is shifted because mandible was going on one side because she was chewing. Mandible means lower jaw. She was chewing from one side only. So we had to deprogram the muscles and did ortho. Then we replaced the teeth with implants and prosthesis. The next speakers are going to speak on that. So what the bottom line is, function is more important and the smile. So we do what is called as functional smile design. So friends, that is very, very important. A simple gap, one has to find the diagnosis, why this gap? And friends, this gap was traumatic bites. She opened the bite and then we went into laminates, equal spacing. So this combination of ortho aesthetics. This girl wanted to get married. She came, basically she came 7 years before. And now she told me within 1 month she's getting married. So I said, well, I can't do anything now. So she said, my fiancé doesn't like this tooth. She don't mind this one. So what we did was temporary, we did it. This is the smile we gave her temporary, before and after. She liked it. She has not yet come. She's become a mother, but I hope that tooth is still there. So this is what one can do. And the last thing I want to show you, that we can convince anybody to go in for ortho.
About Dr. Miker, all I can say is that he's one of the best human beings that I've met in this city. Of course, we all know how great he is as a doctor. But I don't know how many of us knows actually what kind of human being he is. He's so generous. He's so passionate about his work, which I found out when I met him for the first time. So I don't know. I went up to him to do my teeth, and I told him that I want gaps. I want to do it like in a shortcut way, but he is kind of doctor who told me, you should not do gaps. First, it's expensive. Second, it's not natural. He would have made for the money out of me, but he didn't. He asked me to go to in a natural way, and he asked me to put braces, which I was worried about because I thought it would be a long process with pain, and that exactly happened. I went up to him after doing the braces thing. I again went up to him. I told him that, doctor, it's painful after 3 days, and I want to go with I really have a shoot coming up, and I really can't take it. And again, he motivated me, consoled me. He told me that, Raj, just bear with it for 2 more days, and I need to thank him later. And that's exactly now I want to thank him. I really want to thank him that, I listened to him.
So that was my presentation. That's what I did in my patient's mouth. This is what one can do. So ortho is my first priority. If the teeth you can convince anybody to go in for ortho. The way you convince is very important. So smile designing doesn't mean you cut the tooth and do any damn thing. It's always better to understand the patient, have patience, give patience to the patient, and give a beautiful smile with the function. And I say function is very important, because the emergency in dentistry is not pain if one can't eat. And the function has to be there, even if the teeth are there or teeth are not there. And that's what I would like to believe in, is functional.
Thank you.
Thank you,
Yes,
Ishi.
thank you. So thank you so much, Dr. Miker. Yes, I'm sure that all of you who are watching have got an idea as to what is his range of work. It's not overnight, but I've seen him through many, many years. We go back a long way, and he still has a great way to go. Every time he doesn't fail to surprise me. And can you imagine someone who's gone through COVID, he's spreading smiles, and he says smile through COVID. Only he can come out with a concept like that. So thank you so much for being with us. Please don't go anywhere. But yes, listen to the others as well. Take a break if you wish. But yes, the next speaker, ladies and gentlemen, is somebody who's just what Dr. Miker said. Can you stop screen sharing, Dr. Sandesh? Dr. Sandesh?
No, I can't. You have to do that.
You have to press, stop screen share. It's not me. It's you.
I stopped it.
Okay? Yeah. Okay. Fine.
Gone? Are you still there?
Yeah. Gone. Thank you. Gone. Okay. Right. So these are the online glitches. Don't get excited by it, everybody. But we're making the best of time and everything else and technology. And the next speaker is just what Dr. Miker mentioned, that first I would prefer somebody do this orthodontics, and if it doesn't work, then they can come to me. Function is most important. So the next speaker I'm going to introduce, nevertheless, every single speaker on our panel is accomplished academically. They have a great deal of experience, and most of them are my friends. And everyone else who's not, I intend to make you my friend. You have no other choice. So at the end of the day, this gentleman who's coming by is a dear friend of mine. We share a lot in common. We've had good times laughing and dining together. But at the end of the day, let me tell you that I really respect and admire his intelligence. He's a globally esteemed speaker, a brilliant practitioner, and he's also the vice principal of Raga's Dental College. He was previously on the board of orthodontics and the president of the Indian Orthodontic Society. He's been into the field of orthodontics for many years, almost 3 decades right now, runs a roaring practice in Chennai. Ladies and gentlemen, if you really needed to hear about what is straight tooth, what is crooked tooth, we've heard about straight people and crooked people. But in order to get a little more specific, we have someone amongst us, a dear friend. Let's welcome Dr. Nr Krishna Swami. The screen is all yours, Krishna.
Thank you so much, Usha, for your very lavish introduction. And of course, it's indeed a pleasure and an honor to be on the same platform as so many brilliant speakers, not only from dentistry, but from other facets as well. The previous speakers spoke a lot of importance both about health and about appearance. Dr. Abhirami mentioned about oral health in a holistic point of view and how it constitutes a factor which is very essential for general health. And of course, my good friend, Dr. Sandesh Miker, virtually mesmerized all of us with the kind of smiles that he can create. What I am going to do is to mix and match and tell you something about the benefits of not only a good smile, but also how orthodontics can enhance one's oral health. You know, for several years, the concept of good health is perceived as somebody who does not have a disease. That's what the health is all about. But in recent times, the WHO has reclassified health. It doesn't necessarily mean absence of disease, but it also speaks of a healthy person is one who has a complete physical, mental, and social well-being. And today, the WHO's theme for treatment is to maintain and enhance the patient's quality of life. And when we talk about oral quality of life or oral health quality of life, what we particularly imply is that if somebody has an oral disease or a dysfunction, then their ability to adjust and adapt to the situation and still lead a good quality of life is what is essential. But it is not only about having an oral disease like a caries or a gum disease, but it's also important from the point of view of appearance, because crooked teeth or malaligned jaws can bring about a social handicap and can produce a psychological distress. It is simply a fact of life that appearance, particularly facial appearance, and how the teeth and the lip relate to the rest of the face has a great effect on an individual's psyche. And if one does not have a pleasing appearance, it can lead to a psychosocial problem. The evolutionary psychologist Miller said, and I quote, "The vast social primate brain evolves to pursue one central social goal, that is to look good in the eye of others. And that is what we all strive for." So what I'm going to talk about is crooked teeth, or what is known as malocclusion or bad occlusion or bad bite. And the specialty which deals with this is, of course, orthodontics. Now, this is the common caricature that we see of anyone who's stupid, mentally challenged, idiotic, not doing well in life. The most common caricature is for them to have teeth which are sticking out and have an ugly face, which not only uses a broom to fly across, but also has a very prominent lower jaw. So that's the caricature of somebody who is not good looking. So what happens if somebody has such poor or inferior looks? It certainly leads to a very low self-esteem. And in school, they don't perform well because teachers don't expect anything out of them, and the students don't progress because teachers don't expect anything out of them. Nor do they make friends because they're all the time bullied by their friends and peers, or if they have one. And later on, as they move on in life, and if they somehow manage to get a college degree, finding a job is a big challenge because physical appearance is an impediment. And of course, finding a life partner is still more challenging because generally people like good-looking individuals. Now see what a transformation an orthodontic treatment can do. It did take about 1.5 years, but then there has been a phenomenal benefit by getting in early when the individual is growing. We're not only able to push his teeth back, but we are also able to make his jaw go back and make the lower jaw come in front But above all, we could make this individual go far in society so that he is now very well adjusted and he is able to compete and excel in whatever he does. That probably is the benefit of orthodontic treatment. It not only improves his smile, but certainly improves his position in society. Now, this is not something that we can poo-poo away. And this is an article which appeared in the Time Journal, magazine recently. It tells you about the importance of physical appearance. The whole world is spending so much money on trying to look better. And look better is not purely a vanity. And the money that is spent on cosmetic treatment or on cosmetic dentistry, like some of the fantastic cases Dr. Sandesh Miker was showing us, is not primarily to look good, but when they look good, it opens a lot of doors, make them feel better, and make them go places in life. So that's the single most important benefit of having a wonderful facial appearance. A good facial appearance can never be complete unless one has a pleasing smile and a very proportional teeth in relation to the rest of the face. There are other benefits to orthodontic treatment besides appearance, and this is not uncommon. Individuals who have teeth that are sticking out often find it very difficult to close their mouth. And the most common problem in this age group is that when they play some games or when they have a tooth which is protrusive, it's very vulnerable, it tends to crack, and once it cracks, it's a lifelong maintenance issue. As you can notice, this girl, because of an inability to close her mouth, has had her front teeth knocked down when she was playing some game, and it has resulted in the tooth chipping off. And over time, you find that the tooth has lost its color because it lost its blood supply. And now it requires a lot of dental intervention, including probably a root canal treatment, a crown, or a bleach. If she is lucky, she can maintain it for life. But if the fracture has been very extensive, the poor child has to lose a tooth and probably has to have an artificial replacement for the rest of her life. Now, how about this individual? She has a major issue in chewing and swallowing. Sure enough, nobody starves because they don't have good teeth. In fact, not having teeth is not related to one's ability to eat. We all make adjustments. When we have sprain, we put pressure on the other leg. When somebody is handicapped with polio, they still walk around. But then it requires an enormous amount of adjustment. And that is what happens in an individual like this. She has got a bad bite. Her lower jaw is too small and it doesn't meet the upper. And for normal biting, the upper and the lower teeth have to come together. The incisors tend to incise or bite the foot. And the tooth which has the long conical appearance, which is the canine, is used for tearing the foot. And the teeth at the back, which is the molar, has a large surface area so that one can chew the foot. So one is handicapped for a lack of proper bite. This is what happens. Their ability to masticate or eat food becomes less. They require to compensate in the sense they have to bring the jaw in front all the time. And when they keep doing that, the muscles tend to a lot of pressure, and over time they have pressure in the muscle and pain in the muscle. And in worst scenario, like Dr. Mayeka said, it can lead to what is called as a jaw joint problem or a temporomandibular joint problem because of altered function. And these people somehow learn to live by eating less, and they don't enjoy most of the food that requires proper mastication. And there is scientific evidence to suggest their ability to intake food and digest it becomes less because the bite is very bad. Now, what happens with speech? When an individual has gaps like this in his front teeth, it is common that the air escapes through this, and this is what is commonly referred to as lisping. One can go to a speech therapist and make an attempt to get the speech corrected. But unless the gap in the front is closed, either with orthodontic treatment or by alternate methods, the quality of speech will never improve. This is another condition where a child has a problem because the lower jaw is outgrown the upper and the lower teeth are ahead of the upper. It is virtually impossible for this individual to pronounce words like F and V, because when we pronounce F and V, the lower lips comes in contact with the upper front teeth. And by virtue of the fact that the upper front teeth is locked behind the lower, this individual's ability to pronounce what is called as labial dental fricative is restricted. There are those children who tend to suck their thumb for a very long time or have what is called as an open bite because the upper and lower teeth don't bite together. So it's virtually impossible for these kids to pronounce words like the, school, or church, because there is no contact between the teeth and the tongue. And once they don't have a proper contact, they make adjustments, and the clarity of the speech is not very good. This young lady was very pleasant to look at till the time she opens her mouth. Look at how red and diseased and inflamed the gums are, especially the gums behind the lower front teeth. That's because the upper teeth are moved back or retroclined, and when she closes, it is virtually hitting or impinging on the gums. So in spite of the fact that she takes enormous efforts to brush her teeth, it's virtually impossible to have a good gum because of the constant trauma. So over time, these individuals tend to have bleeding, the gum becomes diseased, the underlying bone quality becomes poor and tends to become less, and eventually they may lose their teeth. A timely intervention by somebody who does a gum treatment and thereafter an orthodontic brace to move the upper teeth where it belongs and to bring the lower teeth in contact with the upper and maintain a good contact between the upper and the lower teeth certainly enhances the quality of gums. We can very well appreciate the before and after picture. The picture before looks very inflamed and very red. The picture after treatment shows a very healthy gum and has got a pink appearance, which shows that it is normal, healthy gums. So this is how her bite is. Now, because the upper and the lower teeth bite, and the upper teeth do not bite on the lower gums, her gums are healthy. And now she has reasons to smile, not only because her teeth are straight, but because her gums are healthy. So there are times when, despite diligent brushing, individuals have decay or what is called a dental caries. You can very well imagine how difficult it is for this lady, who's a senior executive in a public sector company, to brush her teeth. No matter what she does, she has a couple of teeth which are broken down due to decay. And the fault is not hers because the teeth are so irregular. It's virtually impossible for her to clean effectively. And she seldom smiles because she's very conscious of the fact that the front teeth are broken down and they look very ugly. So this is what we can do with some good orthodontics and followed by some prosthetic procedure, which my friend Dr. Padmanabhan will speak about, and some restorative procedures which Dr. Sandesh Miker alluded to. This is what we can have. Orthodontic treatment help in aligning the teeth. The composite restoration help in maintaining the size of the teeth, and prosthetic replacement of a missing teeth. So orthodontic treatment enhance the other treatment, namely the prosthetic treatment and restorative treatment. And this is how she is. She's very happy and a very pleasant looking lady she is. Now, today we have a major problem in the society, which is called a sleep disorder, or like the professionals call it, it is the obstructive sleep apnea. This is multifactorial, just like hypertension. This is supposed to be due to stress. This is supposed to be due to lifestyle, but it also is due to an anatomical imbalance between the upper and the lower jaw. As you can notice, this individual is not smiling and he has reasons for not smiling. He's got huge bags under his eye. He's got a double chin, that's the amount of fat that is accumulated, which means that he is obese and he's got excessive adipose tissue or a double chin. Part of the reason for all this is because he has a lower jaw which is too far inside. And the reason that the lower jaw is not grown enough is because the upper teeth are leaning inward and have prevented the normal growth of the lower jaw. With the result, you can virtually see that even when he smiles, the lower teeth is not visible. But to make matters worse, and this is what has happened over time because the upper teeth have been virtually sharing off the lower teeth. You can find all the enamel is gone. And the next layer of the teeth, namely the dentine and even the root, which is visible. And the gum tissue is worn off completely because the upper teeth are biting into it. And there is no way that one can save these teeth, and eventually he had to go. But more than this, his biggest problem was his lower jaw was too far inside. And the red area that you see, that is the airway. It represents the airway at the level of the nose, at the level of the mouth, and further down at the level of the pharynx. The entire airway is constricted or very narrow. And the reason for the airway being very narrow is because his lower jaw is too far back. And the reason for the lower jaw being back is because the upper teeth are leaning inward and are preventing the lower jaw from moving in front. So this guy has a problem with his appearance. This guy has a problem sleeping. This guy has a problem with function because he can't sleep. And his wife virtually dragged him into the clinic because he said, I can't sleep with this man, and no pun intended. And of course, you can see that the oral health is very poor. So if we were to correct this, the first thing that we have to do is to correct the position of the upper teeth. So that's what we did with braces. Then, as I said, the lower teeth is completely broken down and there's no bone support. So those teeth have to be sacrificed. And once we moved the upper teeth out of the way, then the maxillofacial surgeon or the oral surgeon went ahead and did a jaw surgery and brought the lower jaw in front. So the purpose of doing the jaw surgery is not only to improve his facial appearance, but also when the lower jaw comes in front, the windpipe becomes wider and now he's able to breathe properly. The sleep disordered breathing is corrected, or what is called the obstructive sleep apnea is eliminated because the obstruction is removed. And then he had implants fixed by an implantologist, and he has some temporary teeth now, which he'll get replaced eventually. So that is just an X-ray, which is a 3-dimensional X-ray. You don't have to know too much of it, but I'm certain that you can appreciate between the picture in the left and the right, the red area is increased enormously. So with the teeth moving out and the jaw coming in front, the ability for the pharynx to enlarge and breathe normally has improved. So now we've converted him from somebody who's got an obstructive sleep apnea to a guy who has got normal breathing. And now he's happy for several reasons because his teeth are looking good. He's able to bite better. The double chin is gone and the chin is prominent. And finally, the overall facial appearance is improved. And now his quality of life is improved so much that he takes a lot of interest. He goes for some exercise and he's lost some weight and he's a cheerful guy and his wife wants to be with him all the time. Then, of course, when we have conditions like this, when the teeth don't bite properly, one can get into what is called as a parafunctional habit, or they tend to grind the teeth. So this is called as Bruxism. So when one keeps gnawing the teeth all the time, especially at night, the enamel gets worn off, leading to hypersensitivity. The teeth can become mobile because due to the constant pressure, the gum becomes lax and the bone loses its strength. And of course, due to constant clenching at night, the muscles become very sore, and these have to be relieved initially by wearing a stent. But if left unattended to, it can lead to a jaw joint problem, which is referred to as a temporomandibular joint disorder. It can start with a mild noise or what is called as a click. It can make a little more noise like a wrapper being open, so that is called as crepitus. So when we have crepitus, it indicates that there is a disease in the joint. Then there are a lot of individuals who cannot open the mouth, not only to eat, but even to speak becomes hard. And eventually they suffer from pain, and that's when they come to us. So this requires multidisciplinary treatment. It may first require the muscles be made to relax. Then you require braces to correct the teeth. And then, of course, you may require some restoration to correct the teeth which are worn out and restore normal function. And finally,
Krishna, you have just 1 minute left. Yes.
Yeah, I'm done. So the last question that I want to address is there are many people who ask me, is braces only for children? Is braces only for smile? The answer is no. Age is not a limiting factor provided the gums are good and the bone is healthy, and there are several options that one can have. And thank you so much, and I hope I've been able to address some of the common concerns that the public has. Thank you, Usha.
Yes, please just stop the screen share, Krishna.
Yeah.
Yes, thank you so much. Thank you so much. So thank you so much. It was really insightful. And thank God for those visuals that we could really, let me just switch on myself. Yep. So thank goodness that we could see all the lovely visuals. And I'm glad in this case, we actually went through with the PPT because I'm sure that our audience on YouTube as well as on Zoom could appreciate all the changes that all our eminent panelists have really brought about. Could you please mute your microphones, everybody? Yeah, just have some respect for the others in the room, please. And at all costs, just please just mute your microphones. Don't make me do it. I think we're just like a few of us, friends and relatives. So if you want to chat up, please just mute your microphones and do that. Thank you so much. Thank you so much. The speaker, I'm not really muting the microphones, but Please just enable yourself in case you observe that there is a mute microphone, the symbol that you see there. Yes, thanks a ton. Next coming in is a person who's again a very dear friend. He's a very young man. I've known him for many, many years. I know his whole family, including his mother-in-law, who's now become a great friend to me. And she's a very proud mother-in-law. She keeps asking me, do you know my son-in-law? Do you know my son-in-law? What great work he does. And, I've rarely met people who are as professional as the gentleman who's about to come is going to speak. He's got a great sense of humor. He's always very, very kind. He's always very professional. Whatever he does, I've observed that even though he's funny, he does his own thing. He's a great orator. He has a podcast. He's a little unlike the rest of the run-of-the-mill kind of dentist. But I would say that right from his student days, I really know that he's been committed to what he really likes. He's a great singer. He plays the guitar, and he's a man with a lot of tastes in fine art. He's a father to 2 lovely children. Currently, he's building his muscles. Earlier, he used to be leaner, but right now he takes sessions on how to be fitter at 40. So he pumps muscles and, takes pictures of his biceps and puts it out there. And I can see everybody coming in and saying that, I wish I had a root canal, because everyone's just dying to go there and sit on his chair. Ladies and gentlemen, to a subject with a lot of patients and general public keep asking me about, and they literally dread, is the word root canal. Now, I'm not sure why this dread was caused. I'm also not sure why they really believe that all dentists are out to fleece them or, take away all their money. To clear a lot of myths, I've met a man who has personally been a doctor to me. And believe me, after he did a couple of procedures, I came back to my own clinic and I had an experience with my spouse, and I really got angry because obviously the experience was not as pleasant as the previous one. And I'm just trying to tell you that he really cares about a patient. He does a beautiful practice. He also is very honest, and he will tell you exactly what works and what doesn't work. Ladies and gentlemen, with great pride, I've actually managed to get on Dr. Siju to log in from Dubai. So let's welcome Dr. Siju. Dr. Siju, the screen is all yours. Please come by.
Can you
Yes,
see my
we can.
screen?
Yes,
Thank you
we
so
can.
much. Thank you so much, Ushi. Always a pleasure to be associated with anything you do. Let me just try and minimize this because I'm not able to see. Okay. Okay.
Yeah.
So like Ushi mentioned, if you are a lay person, if you're not a dentist and somebody tells you that you need a root canal, chances are you probably are going to be petrified, okay? But be aware that you're probably not alone, because even US presidents, so you can see in your screen, these are dialogues uttered by former US presidents. Bill Clinton said, I will step down from the foundation's board if my wife is elected president. It's a decision as painful as a root canal. Obama, not to be left behind, said, we all hate bank bailouts. It is as popular as a root canal. So you can see from these 2 gentlemen's words that a lot of people equate root canals with something miserable or something not something which they aren't looking forward to. So as an endodontist who's been doing this for 20 years, we always wonder, why is it that people are so scared of root canals? So it is my goal in the next 15 minutes to educate those of you who are listening, to convince you that a root canal is not as bad as it seems to be. So before we look into what the advances of root canals are, I'd like to quickly explain what a root canal is in very, very simple terms. So this, on the left is a diagram of the tooth. And if you look at a cross section of the tooth can be broadly divided into 3 layers, okay? The outermost layer that you see here is called the enamel. So when we smile, the white thing you see is called enamel. Underneath the enamel is another hard layer called the dentine. Okay? Underneath these 2 hard layers, there's an innermost soft portion. It's known as the pulp. This pulp is contained in a hollow space known as the root canal. So you have a root canal filled with a pulp, and usually the pulp and the root canal are not exposed to the environment outside. But let's say you get a cavity or decay, as we call it. And that decay penetrates the enamel, penetrates the dentin. And if you look on your right and it reaches this thing called the pulp, then the pulp can get damaged. And once the pulp is damaged, that's when people have toothache and they come to the dentist saying it's really hurting badly. So when you are faced with a tooth like that, you have two options. One is to remove the tooth, which means you just pull the tooth out. Or the second option is what we call root canal treatment. Okay. So in a root canal treatment, what we do is we clean up this cavity, we remove all this damaged pulp, and then replace the space occupied by the damaged pulp with a sterile material. And we call this whole process as root canal treatment. Now, when people hear root canal treatment, or the dentist tells them that they need a root canal, this is a very common expression. They start getting paranoid. But and probably similar reactions, probably propagated by these sort of world leaders speaking things which aren't really true. And I'm always wondering why or what could the reason be. And I'm pretty sure that one probable reason is the vision of all of us of what we have as what dentistry is and how root canals are done. So when we mention the word dentist, especially to people who have seen a bit of life, a lot of us have traumatic memories of dentists as children. So when we go to a dentist when we were small, we probably had some traumatic episodes. And the minute when people say dentist or dental office, we visualize something like a modified torture chamber with a lot of these tools, which also look equally torturous. But dentistry has changed. They aren't anymore, the clinics aren't like these anymore. And if you look at our clinic in Bangalore, it's nothing like a modified torture chamber. It's airy, it's spacious. So that's the first thing I'd like to tell the layperson who's listening to this. Clinics have changed over the years, and we are not here to torture you. We are human beings, and we'd like to make the process as comfortable as possible. So that's the first thing. So our patients are more like this. They're not petrified. They're actually smiling when they come to our clinic. And that's the experience we wish many of you to have. And that's the reason we'd like to dispel some of the myths. If you look at how we work, it's nothing like most of us visualize how dentistry should be. This is how we work in Bangalore in our office. We use a microscope to perform root canals. So it's very, very comfortable and not what you think a root canal is supposed to be. This is our Dubai office, and it's equally airy, spacious, nothing like a conventional operatory. And we almost follow the same protocols even in Dubai as well. So you can see me in Dubai, we're using a surgical microscope to work on the patient. And this is something I'd like to stress upon, because I started using a microscope to do root canals somewhere around 2004. So I've been using a microscope ever since. And I'd like to convey some of the benefits of why we should use a microscope in root canals so that people are aware of these things. So let me try and explain this by showing you something non-dental. So here's a picture of a hand with 4 fingers, and I'm looking at this hand with 3x magnification, which means 3 times the normal magnification, and I'm looking through a microscope at this hand. As I increase the magnification, you can see here I'm increasing it to 4x, and you can see the number of fingers reduced. So you can see 3 fingers now. And I keep on increasing the magnification to 8x, so it becomes a little more bigger. And you can see at 10x, you can actually see the grooves on the finger. You can see the hair follicles. And you go up to 20x, you can actually perform surgery on a single hair follicle. So that's the power of the surgical microscope. Now, why is it relevant to root canals? Because most root canals are as tiny as these hair follicles. So if you're not using a microscope, you can probably miss a lot of anatomy. And that's the reason why we use a surgical microscope for all root canals. So when we look through the microscope, we see that what's supposed to be very tiny, because these teeth are very, very small objects, and then inside these teeth, you're hunting for 3 or 4 canals. So when you look at the same image through a microscope, what we actually see is something like this. So you can see the difference is tremendous. So it's no longer dentistry as it was practiced 30 years ago, 40 years ago. Things have changed. And the other advantage of doing dentistry under the microscope or root canals under the microscope is that in the past, say 20 years, 30 years, or even now in a lot of clinics, the dentist does something in your mouth, but you as a patient aren't really aware of what's happening there, right? But when we work with a microscope, everything is transparent. Once the procedure is done, here you see me explaining the whole process and showing the pictures of what we took through the microscope and sharing it with the patient. so that everything is transparent and the patient knows exactly what you've done because you're showing it to them immediately after the procedure. So the whole process is very different from what people are used to. So that's the first thing I'd like to convey. And in addition to that, in the limited time we have, I'd like to briefly touch upon some of the common myths or some of the questions that we've got over the years and try and explain why most of these are exactly what they are, which is just myths. They are not real facts. So the common misconceptions, first of all, is that root canal treatment is painful. Secondly, root canal treatment takes a lot of sessions, which means you have to keep coming back again and again. Thirdly, root canal treatment is expensive. Fourth, it's better to pull out the tooth. Why go through all this? And finally, root canal can cause cancer or some other diseases. Okay, so let me just briefly touch upon some of these myths. I think the most common myth is this: the root canal treatment is painful. Okay, so everybody says, oh, root canal, oh, it's terrible, it's terrible. And this is a very common dialogue I get, especially from women who come. They say, this is my fourth child, or some people say, I've had 3 children, and I think delivering a kid is easier than having a root canal. And then we have to convince them saying, no, 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 this, that. And eventually, this, mind you, all this is from people who never had a root canal. But once you have a root canal, this is what they understand, because root canal treatment doesn't cause pain. It actually relieves pain. So we are here to relieve you of pain, not to create more misery for you. And most of our patients are actually smiling at the end of the procedure because they come to realize that the anticipation was actually much, much worse than the actual procedure, which never really pained at all. So that's the first myth I think you should dispel. Root canal treatment isn't painful at all. And I have evidence right here in front of me. You heard Ushi saying at the beginning of the procedure, she's had, I don't know, 2, 3, 4 root canals with me. And so I can't lie about this. And plus, I'm from Bangalore and I've been around 20 years. So I'm sure if I was a really dreadful, painful dentist, you would have heard a lot of people complaining. And we don't get any complaints. I think most people who've had a root canal say the same thing, that, you know, it didn't hurt at all. And I didn't even know what was happening. So that's the first myth that you should dispel. The second is root canal treatment takes many sessions. Now, in the past, this was true because when we were kids, we used to go to the dentist, and then the dentist used to start a root canal, and it used to go for months together. It's not true anymore. These days, when we do a root canal, we just do it in a single session, or sometimes it takes 2 sessions, and that's it. Most root canals are done in 1 or 2 sessions. It's extremely rare that a root canal goes on to more than 2 sessions. So that's the second myth that you need to dispel. The third one is that root canal treatment is expensive. Now, expensive is a very relative word. When you say expensive, you should always compare it or analyze expensive compared to what? Now, is it expensive compared to you extracting or removing the tooth and then going in for a replacement? Absolutely not. When the tooth has reached a stage where a root canal needs to be done, if you want to keep the tooth, then the root canal is the most economical option that you have at that point in time. So I don't think it's really expensive compared to all the benefits that you can get by keeping this tooth, especially if it's a tooth in front, which is important for appearance, or a tooth in the back, which is important for function. So expensive? I don't think so. The other question we always get is, Doc, why should we go through all this? Why don't we just remove the tooth and be done with it? Right? So removing a tooth is easy because you can do it faster. And it can be done in 1 session. But have you ever thought what you are going to do after you remove this tooth? What are you going to replace it with? So when you consider the trouble of replacing a tooth with a prosthesis, then I think you should think twice before you make the decision of extracting the tooth, because you have a more conservative option of doing a root canal. And the last of all, this one isn't that common, but we do get some patients once in a while who come and ask, Doc, I've heard root canal causes cancer, or root canal can cause some other systemic diseases, because these are because of misinformation spread to the internet and WhatsApp groups. People just forward things without any basis of science. And if you analyze, whenever you get a forward on WhatsApp or on the internet, one should always look for evidence. And you will realize that most of the so-called cited evidence of root canals causing systemic diseases are from 100 years ago and done in very crude studies. So be careful when you get these forwards by WhatsApp or internet. They aren't necessarily backed up by solid science. So in a nutshell, this is what I hope to do in the past 10-15 minutes. I'm hoping that I managed to dispel at least some of the myths that many of you have in mind. And I'm hoping that the next time you hear that you need a root canal, you're going to come to the clinic. And when you come to the clinic, I promise you, you're going to see us smiling like what you see on the screen. And I hope that you as a patient also are lying on the chair and smiling like this lady over here. Thank you so much. If you want to reach out and if you want to have any doubts, you can wait till the end of the presentation and we are here to answer your questions. But even after this, if you still have any doubt and you want to drop in a message, you can always log on to my website. It's sijujacob.com. We have a contact column here where you can leave your message and I'll be more than happy to answer any queries that you have related to root canal. Thank you, Ushi. Back to you.
Thank you so much, Siju, for that. Could you stop the screen share, please, Siju? Yeah. Yes, thank you so much. So we heard, this wonderful young man share about such a dreaded procedure. And believe me, you must visit not only his clinic, but all the specialists over here. They have fantastic setups. They do fabulous work. And each one is excelled in their respective domains. Now, Siju is one option for all of us. If Siju didn't work for you, which is a very rare occasion, what stands between the man who's coming next and you could be Siju, right? So I would urge all of you to go to Dr. Siju and try saving all your teeth. If by chance you cannot, then my friend who's coming next is going to dispel a lot of myths that again people have in their minds. And believe me, it's like the dentist won an award and they gave him a plaque. So at the end of the day, we are stuck with something which is so restricted. We are stuck with something which is complete rumors. We are stuck with something where people believe it's the last priority. But let me tell you, if you understand your mouth and if you understand your oral cavity, your teeth and everything around it, I think you needn't even worry about the rest of the body, because 90% of the time, everything begins in your oral cavity. And 90% of the time, there was a person who called me even yesterday saying that because they neglected their mouth, because they neglected their oral health, the patient has ended up with bacterial endocarditis. So please, for heaven's sake, just ensure that you look after your oral health. Prevention is a very big thing in oral health. You can prevent a lot of problems. People who are suffering from chronic diseases, I think it's very important that you look after not just your gums, but also your teeth and all the other structures that are surrounding it. So there will be a lot more tips coming your way. We have two more fabulous speakers who are here today to take you through the next session, which is missing teeth. Now, when you knock off a tooth, if you're 10 years old or 15 years old or 25 years old or 50 years old or even 90 years old, there are 100 options people talk about. In the older generation, we always had a bunch of teeth which were made of plastic in your mouth. Half the time you kept it outside. The rats were running away with it and somebody else was running away with it. If you're angry at someone, we would just pluck it out and throw it at somebody. So it was more a tool outside the mouth. But since then, science has progressed a great deal. Like Siju showed the clinics, my friend who's coming next has also been in practice for not just 1 or 2 years, but for almost 3 decades plus. He's been an academic that I know of, one of the few dentists with a brilliant sense of humor. My instant connect with him was because he cracked jokes and he had a glass and a pitcher of beer. And I still remember that he was one of those few with whom he used to go pub hopping and he used to keep telling us, like, show us the lovely places. A man who's always been mentally young, physically young, very vibrant, and a wife who's been a friend. I believe that this gentleman is going to come here, talk about, do I need a crown? Do I need a bridge? Do I need this? Do I need that? Why are they cutting down healthy teeth? Now the latest is implant. So the moment you step in, they'll say you need an implant. I keep listening to these stories from people and I want to debunk a lot of stories. I want somebody who's as experienced as Dr. Padmanabhan, who was heading the department, has been a professor of prosthodontics for donkey's years until he decided to continue with his practice now. And he's been on the board. He's currently the chair of the Indian Prosthodontic Board. He's been a great academic, a good researcher, and most importantly, a good orator. Ladies and gentlemen, the screen is now going to be shared by Dr. Padmanabhan, who's one of the most reputed prosthodontists and implantologists in this, not only in this country, but reputed all across the globe. Welcome, Dr. Padmanabhan.
Thank you, Usha. So nice of you to have given excellent words. Thank you very much. So I start with my sharing of the screen.
Yes.
And I go right away. Good evening and my respects to all of you. And I bring very warm greetings from Chennai. And First of all, I would like to say that I'm a prosthodontist. Very often this particular terminology is not being pronounced properly, and then a lot of people stop with pros, and things like that. So we, I just want to say we are prosthodontists. So we work on replacements. And when I started my practice quite some time back, I used to be very envious about Krishna, who was my classmate who spoke a couple of, like about 10, 15 minutes back. And I used to be very envious about Dr. Sandesh also, because all the most beautiful young women go to them and none of us turn to us. All of us, all the oldest ladies with lost teeth used to come to us. But anyway, that was part of the game, and we progressed over a period of time. So what is the scope of a prosthodontist in a clinical practice is this. Like Dr. Sandesh was showing, a broken tooth, we will be able to restore it to a normal looking tooth with a variety of materials. Now there are lots and lots of materials. And one myth here I would like to totally negate is expensive material is not the best material. Remember, expensive material is not the best material. You have to choose depending upon the place where you have to place the crown, whether it is a front tooth or the back tooth or whatever it is. Aesthetics is not everything. Function is absolutely very, very important. And I always felt that improving the quality of life is very, very important, mostly, primarily because that I work more on elderly patients. My percentage of the younger patients is much, much lesser. That could be the reason why I have a concept like this. But basically, we are trying to improve the quality of life. This is a very young patient. I have to improve the smile as early as possible. And we tried to give a cap, and then it was. So sometimes we also come across a patient who have lost their teeth, the front tooth. And the worst thing that could happen to this particular patient is losing the front tooth, because they will never ever be able to face the society. They will be dentally be crippled, and facing the society is a big problem, especially if they are in sales, or if they are a manager, or if they are, like taking care of 15, 20 people under them. This is going to be a big nightmare for them. And the number of teeth lost, maybe it could be 1 or 2, sometimes 3, 4, 5, whatever it is. And as Dr. Usha was rightly saying, neglect is the most important thing. That's going to really cost a lot to the patient. Cost not being monetarily, but functionally, aesthetically, appearance-wise, the image that they have in the society. Your loss of teeth need not have to essentially be just a loss of tooth. It can also be loss of tooth structure of the existing teeth also, like you can see in this particular situation. I'll be showing the post-operative or the treatment modalities of all these things also. And if you're going to lose a lot of teeth by sheer neglect, I mean, some time back, maybe when we started practice, maybe there were hardly about 2 or 3 dentists in one particular area. Now, every street has got 2 or 3 dentists. And remember, gentlemen, ladies, maintenance is much, much more easier than replacing or, doing a filling and things like that. It is going to be least expensive if you're going to go to the dentist every 6 months, get a thorough checkup done, and then make sure that there is no developing decay or disease, which can be, arrested in the initial stages. You may also come across cases where you have just lost all the teeth, just 2 sticking out, or even those 2 are not there, there will be. So my field of specialization is to replace all the lost teeth and the structures surrounding that to make the patient functionally acceptable for eating, speaking, and acceptable by the society. He has to smile, he has to walk in the road, and then people have to greet him, and he should also greet the others. For that, he needs teeth, absolutely, whether it is going to be fixed teeth or a removable teeth. So as I showed you in the first case, a young girl came with a fractured tooth, and we have to do something absolutely aesthetical. And I have nothing to say here because Sandesh has already spoken much about it. And we have to give this. And remember, most of the clinicians, dental clinicians, are absolutely qualified to do all these things. You don't have to essentially go to a specialist to do this, but most of the clinicians are capable of doing this. When it comes to orthodontics, you have to essentially, for braces, you have to go to an orthodontist. This is not a case where you have to choose the best in the sense you can go to the best, no problem at all. But the thing is that this is This can be done by all the dentists. There's no discrimination that he can do better and things like that. And the case with this also, if there is going to be, instead of just a couple of teeth breakage, there are about 4 teeth breakage. You can think in terms of caps, and then you can get a very aesthetic smile. And remember, the material of choice here is not the most expensive. No metal ceramic. This is a metal ceramic restoration. So the choice is given to normally the patients, and then the patients have the liberty to choose the best. There are other criteria. It's more a clinical topic. So as a patient, you don't have to essentially learn all those things, but most of the materials give us best of the results. And if you've lost about 2 teeth like this, what we normally do is grind the adjacent teeth previously. Maybe I'm talking about 10, 15 years back, we grind the adjacent teeth, make it a little smaller, and then fix in a sleeve and a cap like this, so that we call this as a bridge. It's like a very typical English terminology, bridge. We just cap the one on the other side, and then you suspend 2 teeth, artificial teeth, so that it mimics the natural tooth. How functional is this? It's absolutely functional. There's no problem at all, but you cannot overwork on these teeth. If you're going to be, imagine the work of 4 teeth is going to be shared by just 2, and both cannot take a lot of loading. So you have to be a little careful. So this is a very versatile, long-lasting prosthesis or an artificial tooth. And the only caution is that you have to be a little careful. You cannot bite bones and all those things with that. It's more for aesthetics. And if you don't want to grind the adjacent tooth, this, as Dr. Usha was telling me, we don't normally grind the tooth off late. For the last about 10 years, we have not been grinding the adjacent tooth, especially the front one. We drive in a titanium metal cylinder into the bone. And this metal is extremely biocompatible. It is being accepted by the body, and it forms the root analog, and onto which we screw in a tooth. And this is absolutely effective. And this is lasting. Remember, please do remember that this is lasting. This is not a 1-day or 2-day affair. It's not going to fall down in 3 years or 4 years. Once you cross the first 3 to 6 months time, it is almost as good as 20 years time. The life expectancy is almost about 20 years, very comfortably without major, as long as you maintain things properly. And this is the case I was telling you about. You just lose the teeth. You lose also a part of the teeth. And this is how the patient looks. And this is how he looks prematurely senile. He must be around 60, but he looks more like 80. So the first and foremost thing is to also correct the jaw a little bit and then give him the teeth. All these things can be done either manually, like what Dr. Sandesh was saying, or you can also go in for digitalization of all these things. And what we did was this. At the end of the treatment, this is what he got. And look at the face now. He looks much, much more younger. You have increased the lower third of the face. He looks absolutely normal. He looks 60 for his age. He doesn't look 80. And this is how he smiles. And then there is, as Sandesh was again saying, there is life in his eyes. He's able to see. The most important from my point of view is that I'm able to improve the quality of life. He's able to eat well. He's able to smile, and society is accepting him as a normal human being. And if you have lost more teeth than about 2 or 3, you can always think in terms of a removable dentures. If the patient cannot afford an implant, implants are expensive. Let's face facts. You cannot get a bench at the rate of a Maruti 800. It is not possible. It is not the quality of the implant. It is the technique that is involved, the expertise that is involved. So it is a little expensive, but the versatility of an implant-supported tooth is much, much more greater than this kind of removable dentures. When we thought, when we started practice quite some time back, all the removable dentures had some clips. It used to hang on to the adjacent teeth. Down the line, after about 5-6 years, the adjacent tooth will also become mobile. All those technologies are slowly getting outdated, and we are inserting now clasp-less dentures with attachments. They are very versatile. They do a lot of good to the existing teeth, and the functionality is also very, very good. And we have replaced the posterior or the back teeth with the get back the functional chewing efficiency. If you have a plan for removal of all the teeth, it is preferable to salvage. The first rule in dentistry, as a patient, when you go, the first thing is, if it is possible to salvage, please save the tooth. don't sacrifice, don't remove the tooth. Because all dentists know that we have to sacrifice. But as a patient, when you go request the dentist, please remove my tooth, I don't want to lose tooth. These two teeth can really help us in giving a very good dentures. We can fix some attachments and give a nice removable denture, which is very, very functional. Sometimes if the patient requires, say, you know, like when when any dentist, not me, any dentist, most of the dentists are very, very concerned about the patients. And when a dentist sees a patient, he doesn't require to say that you need this particular treatment. He doesn't say that these are the treatment I will choose the best. He normally assists you because taking into consideration the age of the patient, the requirement of the patient, the treatment may vary. If this is going to be a 35-year-old patient who has almost lost all the teeth, it is more preferable to go for fixed kind of teeth rather than removable, because if your patient is about 70, 80, and he cannot maintain the implants, it is preferable to go for removal. So depending upon the age and requirement of the patient, we normally change the treatment planning. Not all like toothless areas have to be placed with implant. There is no need at all. You can always change the treatment depending upon the requirement. So in this particular situation, the patient was quite old, and then we thought we'll give a removable denture, a conventional removable denture, like what the old people normally do. And the patients were extremely happy. Look at the eyes. Again, as Dr. Sandesh was saying, the eyes speak a lot. They are very, very happy. And this is how this lady is really sad before, and then after that, there is a huge difference. And the same, as I was telling you, depending upon the requirement of the patient, we can always go in for an implant supported or an implant retained fixed denture. An younger patient, like Dr. Krishna was saying, if this particular patient has to face the society, face the office, if she's managing a lot of people, a removable denture may not give her 100% satisfaction, because quality of life at the end of the day is very, very important. We have to improve the quality of life. And this is how we will be able to fix. And with the implants, there are different kinds of implants. The commonest thing that what we normally see nowadays as a patient is go for all-on-4. All-on-4 is not an ideal solution for all the cases. You have to be very selective, and that most of the all-on-4 cases are successful. Some of them are failures because of poor selection. Diagnosis is very important. Again, I have to quote Sandesh on this. I have to also make a mention about Dr. Silju's specialty. The root canal treatment has really, really improved to a large extent that, we utilize a lot of teeth, we salvage a lot of teeth and utilize them for construction of dentures. The endodontics have got a success rate of almost about 100%, which is a great boon for us because we utilize those teeth to give the artificial teeth. You also hear as a patient what's called a zygoma implant. All these are very advanced surgical procedures. It needs expertise. Not all the doctors will be able to do this. You need specialized training. Implants need specialized training. So you have to essentially choose the dentist who specializes in these implants. And then I would suggest as a patient to also do your homework. Do a Google search. You can educate. You don't have to educate the dentist, but you can educate yourself and then go to the dentist so that you will be mentally be prepared as to what he's going to be talking. So there are situations where I have opted for a removable dentures with just 2 implants, or sometimes with just 4 implants, and then give a removable denture, which is also very versatile. They'll be able to eat at least about 75 to 80% of what a normal dentate individual can eat at this particular age. We also specialize in cases where they have surgically removed the upper jaw or the lower jaw, as the case may be, because of cancer. So this is a very typical case where they have removed the upper jaw, half the upper jaw, and this is the kind of prosthesis. This is going to really improve the speech and function, and most importantly, social acceptability is the most important thing. They are able to very well move around the society with a normal face and smile. Hey, why is that I have done this? So we also specialize in this particular maxillofacial prosthodontics, where if he has lost, this particular patient has lost his left eye. And after the insertion of an artificial eye, which is not functional, it is just cosmetic, this is how it looks. And in a straight face, I'm sure you'll never be able to identify which is the false and which is the natural. And this is part of a specialty. And this is a very crazy stage where the patient undergone a huge surgical defect, and then we work on these cases also immediately post-operatively or wait for healing to take place. And then this is how he looks. There's a huge opening from the side. I'm able to see the opposite side teeth, tongue, and things like that. We work on these patients also, close him, make him eat or drink whatever that he wants, and most importantly, improve the quality of life, remove his rights. He'll be able to walk in the street and dogs will not bark at him. I'm extremely proud to say that all these things are possible only as a prosthodontist, and I really feel I'm very proud to be a prosthodontist. All these things are fine, but what is the most important thing from the patient? Maintenance. If you don't maintain anything artificial, you will go for disaster. So maintenance is absolutely essential. If you think that you will not be able to do the home care exercises, you are in for trouble. At least make sure that you visit a dentist once in 6 months so that he will be able to do the maintenance job, at least caution you about the danger which is going to come, so that the longevity of the service of the prosthodontist is going to be increased, and the functionality and your quality of life will also be improved. So with this, I close my presentation. Thank you, Dr. Usha, for this great opportunity to share the dice with the doyens of dentistry in India. Thank you very much, and Dubai.
Padu, stop the screen share, Padu.
I will.
Padu? Yeah, thank you. Yes, thank you so much. We heard him. You saw what all he's doing. So dentistry is not just about drilling, filling, pulling, billing, and all that. People keep making fun of it. And I believe that it's ridiculous. That is so much for ignorance is bliss. I think it's gone a lot beyond just tooth, beyond just filling, beyond just the drill. It's a whole science which has been developed. We are dealing with all the experts here. We have the best in business. And please, let's integrate everything together. If Dr. Abhirami is here today, it's because we believe that everyone together can bring a lot more to the table than just one specialization. In a world which is riddled with information and knowledge, we have a person who's coming in here with just so many techniques that probably none of us would have even known or heard about. I know her for many years. And Dr. Sangamitra, there is somebody called Anurag Rai. He says, I'm so proud to see my batchmate, right? So there are many people who've logged in. Padu, there's a lot of appreciation coming your way. Siju, you have 5 patients already on YouTube. They're all getting ready for you. Krishna, Sandesh, and of course, Abhirami, 90% of the people have thanked you for what you said because they say it's very doable. So I think these are the small fringe benefits that we get out of sharing. So some people told me today that don't do this for free. Now I have a compliment here saying that you're the only one who gives things for free during this COVID times. And he says you've got a panel of gems. So I'm very grateful to all of you. Thank you so much for investing your time in this. The next speaker and the last one for the day is going to be speaking about all the greatest advances, not only in dentistry, but a science which she has studied in depth. A maxillofacial surgeon by qualification, somebody who believes and has been doing fantastic work in her setup in Bangalore. She's the director of a clinic which deals not with just teeth, but also the face, the hair, the skin. Personally, an epitome of looking good. I've seen a lot of people drooling when this lady walks by. 90% of her patients fake dental pain to just come and lie in her lap on the dental chair. And I've seen a lot of people who come by there and just don't care what pain she's causing. And they will lie down there and say, Doc, just go for it. So personally, she's a friend of mine, extremely qualified, traveled the world, having been to not just France, Germany. She's been the first one to do a lot of things in India. And currently also what she does is one of the few people across the globe. Ladies and gentlemen, it gives me great pride to tell you that when she's angry with you, she'll pluck out your teeth, and she's done that with me once. Okay, so I just want all of us to know that she's extremely skilled, very talented, and most importantly, my neighbor. So we live physically also in spaces which are next to each other. A great lover of dogs. She loves animals and pets. Somebody who's very particular about the way she dresses and carries herself. With a great lot of love, let me welcome Dr. Sangamitra Dasgupta. The screen is all yours, Sangamitra.
I don't see myself in the screen.
Yes.
Yeah, I don't see.
You're very much there. You're very much there.
Yes. So hello, everybody. And thank you, Ushi, for that feel-good introduction. But you're such a liar. Nobody fakes tooth pain to be on my dental chair. I assure you about that. Yeah, you said that dentistry is all about filling and pulling and stuff, but you forgot one thing. It is also about billing. Don't forget the billing part just because you are doing it for free, right?
Okay.
All right. So, ladies and gentlemen, you heard all the experts speak fabulously well on, and they touched various aspects of oral health. Well, to begin, who is a dentist, do you think? Dentist has a D in it that represents a doctor to heal you. There is EN in dentist, who's an engineer, which is the part I'm going to speak on. And there is IST, the artist. You heard Dr. Padmanabhan speak, you heard Dr. Miker speak on that. So you got enough knowledge on that. So overall, oral health to overall health, which is what is the new age dentistry is all about. So let me come out of the mouth. You heard enough of mouth. Let me speak something about spine. Spine in Sanskrit, ladies and gentlemen, is called as Meru Danda. This term Meru comes from famous Mount Meru. It is considered as the axis of universe. Likewise, spine is the axis of body. Every action is routed through spine. Now, if you are into fitness, you would have heard your instructor say that, you know, your core muscles have to be super strong. Why do they say that? Because if your spine is good, your posture is good, your BMR is optimal, you're functioning perfectly well. But yes, most of the spine, now, this is a subject on oral health. Why, being on this panel as a dentist, I'm speaking about the spine, because there is a correlation. Most of the spine is controlled by the core muscles. However, neck spine, the cervical spine, whatever way you understand it is controlled, is stabilized by the neck muscles, the muscles on the jaw, and the position of the neck is dictated by the way teeth meet. Surprised? Yes, you ought to be surprised. Let me show you how it happens. This is a model. If you count from here, midline, 1, 2, 3, 4, 5, 6. Let me come here. I hope you can see me. This is the first molar tooth, or the sixth tooth from midline. If it is seated, the lower jaw sixth tooth is seated right under the upper jaw sixth tooth. It is a good posture. Your neck is like this. Your ears are on your shoulder at right angle. But if this tooth is ahead, then what is going to happen? Your head will fall forward. It is called as lordosis. Lords, you know, lords always walked with the head held high. That is how the term comes, lordosis. Or if the jaw is behind the first molar tooth in lower jaw is behind the upper jaw first molar, then the head tends to fall forward. This is also called as bird face or kyphosis. In this, I think a case was also shown by one of the panelists. So in this case, head falls forward. Now the spine can withstand about 4.5 to 5 kilos of muscle force. Now in these both situations, the forces can go up to 19 kilos. And there's another situation where you saw a lot of patients have the midline shift. When you close your mouth and there is a midline deviation, that means this jaw, lower jaw, upper jaw is fixed, okay? The lower jaw has moved slightly either to the left or to the right. Now, what happens in that case? Let me show you. I'm coming to the PowerPoint, Ushi. Ushi?
Yes, please share the screen. Just click share screen. Open your PowerPoint, Sangamitra. Just open your PowerPoint.
Okay, share screen.
Yes,
yeah.
And share screen. Press share screen. Click on share screen.
I did. Is it visible? Yeah.
Yes, it is. It is.
Okay,
yes.
Perfect. Now, if you see that this person, pretty girl, original is in the middle, and when I overlap the right side onto the right side, you see the person looks different. And I overlap left onto the left, do you see the difference? They don't look as the same person. That means there is an asymmetry. Now, why am I not able to change?
Just click on the left side once, please. And then
I got it. Okay. Now, when this person smiles, so you see that now the muscles are activated. So you see now on the right side, when the right overlap is that the muscles are very powerful. She looks chubby. And on the left side, she looks actually the younger sister of the original ones. Do you see the change? This facial asymmetry plays a huge role on posture. Now, what happens? Let me see this. Okay, now you see the midline is not matching. In this midline is not matching, that means that the lower jaw also has shifted to one side and the head also goes to the other side. So there is an overload. Now it's no more 4.5 to 5 kilos. In structural level, it can go up to 19 kilos. Okay, I'm going to come to this in a while. So this is happening at the structural level. And what are the problems that happens in the cervical spine when there is an overload? Let me also now, this is a structural part. Now let's see what happens. Habits. Now maybe somebody likes the right side. So what do? You take a phone and you take a selfie like this. You go on doing that because you like your right side more. So that gets into your subconscious and that becomes a way of your life, and slowly the overload actually increases. And remember, a habit is very difficult to give up. It takes 21 days of persistent effort to give up or cultivate a habit. Then let's see what happens in the next slide. All the time we are into our gadgets. Do you see the forces are going up to 27 kilos? Muscle forces from head to toe. And that means now there's going to be a problem. Now, can I come back to my stop share? Okay. Let me just check.
Yeah, just stop share. That's all. Just stop share.
All right. Let me also talk about this. Now, see, what do you see this? The head is tilted to one side. And now from head to toe, there is imbalance. It has actually a study done by BBC on lay people. They actually chose 100 people and they did study, and they found out that the occlusal level, the way our teeth meet, that is parallel. This is a horizontal plane, is parallel to this horizontal plane is parallel to the shoulder plane, and all the way till the feet it goes. If the plane in the lower third itself goes awry, then it transmits from head to toe. So problem becomes actually from teeth to feet. And what are the problems that happen? Let's talk about that. Cervical spine caters to the head and neck region. It caters to the shoulder. It caters to the arms. It caters to the fingers and hands. So what are the problems that can happen? The migraine can happen. Sandesh spoke a lot on that. Then the jaw can pain, neck can pain, then the shoulders, frozen shoulder, tennis elbow, numbing of the hand, ringing sensation in the ears, vertigo, watery eyes, sinusitis, to name a few. Then also we have a windpipe and the food pipe in the neck, most important part. So snoring can happen, sleep apnea. I'm going to talk about sleep apnea in a while. Then there is also food pipe, acidity, weight gain. There are a lot of hormones in the head and neck area. They get affected. So a whole lot of problems start like that. Now, is there a way we can prevent this? The answer is yes, we can prevent it. Is there a way we can treat these cases? The answer is yes, we can treat them. Is there a genetic predisposition? The answer is yes. A lot of things you will see running in the family, but the good news is we can fix it. Okay, now I'm going to again go back to the share screen. What all can happen? Okay, we were here. Yeah.
Yes.
But how do I move forward? Yeah.
Yeah, just keep it alive.
Okay, now most of the time we give least regard to baby teeth. We think, oh, this is going to fall off. Why spend money? Why go to the dentist? And we don't think about it at all. Please remember, if Almighty has given us something, it has a purpose. The baby teeth are laying foundation for your permanent teeth. Now, if you see this child, when the child closes the mouth, the bottom teeth are not visible. That means there is a compromise in the tongue space. Tongue is a very powerful muscle. Never mess with the tongue. If you don't give it its space, it's always asking for its space and it will not let you go. If you compromise its space, it will fall on the tongue, on the throat, and it will impair the breathing. If you think the children don't get sleep apnea, I tell you, every fourth or fifth child is mild to moderate sleep apnea if they have the teeth like this. So can we do something like this, something at this stage? Yes, the answer is yes. This is where the bioengineering, the new age dentistry come into play. We've got fabulous materials in dentistry. So what do we do? Look at this. This is a child where you can't see the bottom teeth. What I did, I actually built up his baby teeth. Why? Because I'm giving the space to the first molar to come to its functional glory. I want the lower third to be proper, because if the first molar tooth comes properly straight, Dr. Krishna spoke about straightening the teeth and the advantages of the straight tooth. If the tooth is like this, like on the right side where the bottom teeth are not visible, the first molar. Now, I'm going to take a break here. I'm going to ask you a question. When I ask my patients most times, which is the first permanent tooth do you see in the mouth? Their answer is, oh, doc, what a question to ask. It is the first front tooth, obviously. Yes, that's right, because that's what you see. But actually, that's not true. It is the first molar tooth that comes first, permanent tooth I'm talking about. First molar tooth comes into the mouth first at the age of 6 to 7 years. Why does that happen? Have you ever thought about it? Why? I mean, God must be crazy, right? Instead of giving 1, 2, 3, 4, 5, 6, he gives the 6th tooth first. The reason is, by the time the child turns 5 to 6 years old, the spine formation is complete. Now it requires the stabilization. The core muscles give the stabilization to the most of the spine, and the cervical spine gets the stabilization from the first tooth relationship. Isn't that fabulous? Now, at the age of 6 or 6 to 7, the first molar tooth has come into the mouth. You don't know as a parent. So what happens? If the bite is like this, the bottom teeth are not visible, this tooth cannot come into its functional glory. It cannot come upright. It is going to tilt most times towards the tongue. And then it is more, because if it's not straight, you are not able to maintain the hygiene. It is going to get cavity. It may go for root canal to Dr. Situ, and then put a crown on there. Or it's a possibility that it gets so much destroyed that it has to be pulled out. And that's when the weakening of the entire structure starts. The next spine starts, because the anchor is lost. The problem starts, it's very slow. No one dies when you pull out a tooth, but it's a slow death because your health is deteriorating. So how do we fix this? This is how I built it up, and I allow the first molar tooth. You can see right at the back, there is a space for the first molar tooth to come in. Now I'm able to see this. Now our orthodontist chips in, and we start bioengineering at this age itself. 6 is the right time to guide the jaw. We can prevent surgery. We can prevent a whole lot of problem. And this child, if the child is sleep apneic, he's either going to be slow, or he's going to be irritable, or he's going to be hyperactive. His grades may suffer in the class because he sleeps a lot, but the quality of sleep gets affected. Now look at this X-ray. If you see on this side, on the right side, there is an accentuated curve of cervical spine, the neck spine. But on the other X-ray, you can see that actually it has straightened a little bit. It's much smoother, head is more upright. This is the magic we can create. So this is not only this situation, if the child has a lordosis kind of a bite, where the first molar is ahead, that also you can guide. So you don't have to subject the child when he grows up to any kind of surgery. So this is a procedure without any aggressive treatment. You can actually create magic. Again, this case, as you see, the bottom teeth are not visible. Patient is 30 plus, moderately sleep apneic. Now, I'm talking about sleep apnea. Let me tell you what sleep apnea is all about. Sleep apnea is a term where during sleep, a person does not breathe for a few seconds. Transient stoppage of breathing. Temporarily, there is a breathing, person stops to breathe. And these episodes, if they are more than 5 in a sleep cycle of 7 hours, that means person is sleep apneic. It could be mild, it could be moderate or severe. And we have many appliances given in dentistry, and most people, they use CPAP machine. The compliance with these machines and the instrument, the stuff which we give in dentistry is in first 1 year. It is a study conducted, and it says about 70%. And once you discontinue, it just goes in your cupboard, sits in the cupboard or somewhere lying, and you don't bother to wear it because you don't know the intensity of the problem. You don't care. it's like these days COVID, people don't think that it's important to wear masks. Similar thing happens with the sleep apnea. But please remember, it's a deadly disease. It can cause a whole lot of problems because sleep is something very important. Sleep is it causes rejuvenation, it causes healing. If you're not sleeping properly, it can cause hypertension, it can cause stroke, it can cause diabetes, it can cause impotency, it can cause dementia. Whole lot of problems are associated with sleep apnea. Now, if you see this gentleman, you don't see the bottom teeth. So what did we do? He did go through braces, but then the result was not optimal when we saw this. We did the proportional analysis, face analysis, posture analysis. We took the models, we analyzed the models, we took the x-rays, we analyzed the x-rays, everything we put together, and we came to this diagnosis, and I raised the bite to the analysis wherein I could see that, yes, now the spine is much more comfortable and the airway is opened up. Did I cut the teeth? Well, no, I'm dead against cutting the enamel. Enamel is second hardest after diamond. And if you take away enamel, I don't know whether you know something called kinesiology, it is the study of muscle. If one side, if you have cut up the enamel to place a crown, or for whatever reason, or for the decay, if you have lost the enamel, you will see, if you did do the kinesiology study, you will find that the person is weaker on that side. So I want to retain as much enamel as much as possible. So this is without cutting the enamel, it has been overlaid over the existing teeth and the bite has been raised. Now I'll show you what happened to this x-ray. Do you see the fold on the neck in the pre-op or the right side x-ray? You see that, right? That fold is gone in the other x-ray. Neck has straightened up. You see the vertebral column, the bone kind of a thing, which is more whiter. That's where the space has increased. Now the spine is actually getting 4.5 to 5 kilos of muscle force. So this is so much more comfortable because that is what it can withstand. So the entire system starts responding. The lower third is also restored. You can see there is a gap that has come in and his airway has opened. Now we did the airway analysis. We did all the tests after this rehab was done and the patient is no more sleep apneic. Look at the change what you can bring about. This person used to have a lot of neck issues. After doing this, he does not have any neck problem. You can actually see his smile. His smile is always seen through the eyes. Look at the eyes are lit up. Look at the smile. And also if you see, all of my patients have that inner glow. They don't do any makeup just because they are coming to see me, as Ushi said. No, it is actually an inner glow which is showing because now the BMR is optimal. Now they are able to function perfectly. So you can see that inner glow on their face. They are looking brighter. They are more happy because they are able, their efficiency at workplace has increased. Look at this gentleman this gentleman has lost teeth. And you see that this is a lordosis force. And herein, he was a very severe sleep apneic as well as severe acidity. Couldn't eat anything and he was in a total distress. He was actually referred to NIMHANS because dentists had given up on him, saying that no, he actually knew, because we always have to listen to the patient. Sometimes we think that the patients are psycho. No, that's not right. When we listen to them, and I think I must have been his 4th or 5th dentist who came to, he also went to ENT, he went to a whole lot of people. And then when he came to me and I looked at him, I said, it is because the lower third is dropped, you are lost teeth, that is why you have sleep apnea. And then he turned and looked at his wife, see, I told you, I have teeth problem, and this doctor says yes. And I restored him. Look at him on this picture on the left side, he has not even colored his hair, but I think he looks so much better. His ears are, ears are on the shoulder, he's more upright, he's much more straighter. So this is the magic which we can create with dentistry. Dentistry is not just restricted to mouth, it has gone from teeth to feet. And that is what is my contribution to the dentistry. And this is what I call new age dentistry. And thank you for being with us, and over to you.
Thank you. Thank you very much, everybody. Yes, let me just, Sangamitra, could you please stop the screen share?
Yes.
Thank you. Yes. So thank you very much for that awesome presentation. I request all the panelists to please just switch on your cameras. We have a few questions and I'll quickly run through this. I'll just direct it. Some of them are very common. So I would want all of you to just take on the questions. I'm going to direct it. Some questions were emailed to us since about a week or 10 days. And some questions are being asked over here. I'm going to just direct it to whoever is in concern. The first question, here we go in the interest of time. The first question is, Sangamitra, this is for you. It says, can children also come to you? And would you be able to also detect the problems that you spoke about?
I love to treat children because that is where you prevent the problem, and that's where also the mother nature is actually aiding me. So, a child, if I see at the age of 6, he has another 10 years of growth phase, and actually I can guide that. That is something which is most gratifying, most close to my heart. Yeah.
Okay, thanks. So how young would the child have to be? That's the next
6 years
question.
is the time. 5 to 6 is the time when I start taking children.
Right. So 5 to 6 is the time when Dr. Sangamitra starts seeing patients. Now, Dr. Krishna, same question for you. Please ask the orthodontist, what is the right age to start treatment? Is fixed treatment, fixed braces the only way to go forward? Or is there any other way you will suggest to start treatment? What is the right age? And what will you recommend? Only fixed orthodontics, or is there anything else? We also would like to understand why invisible braces are so expensive.
Thank you. That's a very common doubt in the mind of the public. As far as the age is concerned, if the parents see that the jaw is at fault, like a child has a lower jaw which is too prominent, or an upper jaw which is sticking out, really looking odd, then it's better to see an orthodontist right away. As per the American Association, the earliest age to screen a patient to ensure that there is no future orthodontic problem is age 7. But having said that, some of us who went to dental school in the 80s and even earlier, we were told that the best age is 12 years. You have to wait till all the permanent teeth come and then start braces. But those concepts are outdated. If you start early, we can treat a child so that the jaw can be fixed. During adolescence, we can correct the teeth with fixed braces. In adults, we can treat them so that they can have the benefit of an implant or a prosthesis at a later date. Similarly, surgery, if the jaw has to be done, is better done after the age of 20. And as far as invisible braces is concerned, yes, that's a question that even we orthodontists are asking, because this is entirely a proprietary material which is monopolized by a few companies in the US, and they charge a bomb for getting these appliances done. So more than 50 to 60% of the fee that one pays is to the company. And that's the reason that invisible braces are so expensive.
Yes. The next question is for Dr. Padu. Whenever we visit a prosthodontist, they don't know, they say Crown and Bridge doctor. Okay, so I presume that, yeah. So they say whenever we visit them, they say that the procedures are expensive because all the materials are imported. So why cannot we think of making local materials? Because the billing is actually very heavy, and the excuse given is that the procedures and materials are not from India.
Correct. Excellent question. The problem with manufacturing these items in India is that the requirement is very, very low. I have approached a lot of people, even the titanium, the company called Team for implants. They talk in terms of tons, whereas what we are talking is in terms of grams. So there's a huge mismatch between the requirement and the production. They are used to producing a lot of things. When the production is going to be very, very less, it is going to be expensive. And number two is, it is not only the material which is expensive, the expertise is also a little expensive. An implant, if you have to call yourself an implantologist, you have to go through at least about 400 to 500 hours of studies, which involves money, time, energy, and it has to be borne by the patient. There is no other alternative.
Okay. So now, Dr. Siju, there's a question for you on Twitter. And it says that however much you make it sound like it's a pleasurable job, when the last dentist touched my root, I jumped out of the chair. They gave me a couple of anesthetics and gave me a bill for 20 to 30,000 rupees. Finally, I shelled out almost 50,000. I tried all kinds of treatment recommended, and please request a naturopath also that we tried oil pulling, clove, and a lot of other products, but eventually had to get the tooth removed for 200 rupees. So please tell me, why would we need to undergo a process for so many thousands of rupees and end up removing the tooth for 200 rupees? Dr. Siju, you'll be the best person to tell them what is the ideal way of deciding. Please unmute yourself. Siju, unmute yourself. Just please unmute yourself.
Yeah, okay. So, you know, as everybody will agree, it's very difficult to give advice on something like that because I have no idea about what the case is, what the diagnosis is, what the general patient's systemic health is. So many of the times when we hear stories like this, it's often a problem with diagnosis rather than the treatment itself. Because if somebody is coming with a neuralgia or a myofascial pain or something unrelated to dentistry, but if the diagnosis is not made in the initial stage, then it doesn't matter how good a root canal is, because if the pain is not from a tooth and it's from a non-odontogenic area, then you need to sort that out first. So that's one of the main misdiagnoses, or one of the most common problems we see, because we get referred cases saying that, you know, just go to this doctor and get a root canal done. But when you actually check this patient up, you realize that the pain is not because of the root canal, it's because of something else. And in that case, they need to see a neurosurgeon or a neurologist rather than a dentist. But if those things are not taken care of, I would take that out of the equation. As far as the rest of the problems, I'm afraid I can't answer that without seeing the case. It would be just shot in the dark if you say, I went there and it did hurt and then they pulled it. We need to probably see the case before answering. But I must say that those are exceptions rather than the rule. If the diagnosis is made well and the clinician is someone competent, then the chances of a tooth failing are exceptions rather than the rule. I'm not saying it doesn't happen. It does happen, but those are exceptions rather than the rule.
Right. Dr. Miker, yes, you would love to add to this? Yes, please.
I want to add on both Paddy's question and Suju's question. In Paddy's question, they are asking about the material, but they are forgetting the establishment cost. When you go to a hospital, there's a doctor's cost and hospital charges. So this is what we are supposed to tell the patient, that, you know, this material cost is one. As an establishment, what happens to other expenditure as well as my skill, which is very important. You just can't go on charging just the material cost. Is just, I mean, imagine we are working in the mouth where the patient is conscious. They are forgetting the skill of a dentist compared to general surgeon, that they work on a general anesthesia. Patient is not asking questions, patient is not moving their head, nothing. And here we are doing root canals and crown preparation. Is very difficult job. So time has come that dentist should explain to the patient the skill factor of a dentist, which is very important.
Yes,
That's what Suju just mentioned about the pain factor. There are two things which I want to mention here. One, yes, I got a case now who became a Chief Justice of India also. Later on, he had a pain on percussion on upper left first molar. Root canal was done, pain didn't go, re-root canal, extraction, bridge, and removed 3 teeth, that is second premolar, molar, and then the pain was in temporalis. Siju, you don't have to go to a neurologist, you can go to a TMJ specialist, you can go to Sangamitra, you can come to us. Where the pain was in temporalis, the referred pain of the temporalis, anterior belly, medial belly can go to the teeth. So that diagnosis is very, very important. And then talking about 200 rupees extraction and 50 rupees, 50,000 rupees for root canal, is like talking about I went for a heart surgery and I spent 5 lakhs of rupees and then the patient died and what I spent for cremation is something else. So it's a comparison which one has to do, that, you know, we underestimate ourselves. And coming back to the first question, you started that medical was first and dentistry was second. Let me tell you, medical is apple, dentistry is orange. You can't compare. The comparison only comes because the tradition that good marks go to medical and then less good marks go to dentistry. Let me tell you, dentists are the skillful people than the surgeons who see in MBBS. Let me tell you, MBBS, medicine cures the patient. Dentistry, dentist cures the patient. You don't take medicine. It actually cures the patient. So patient has to know the difference between medical guys and dental guys. They can't compare somebody puts stethoscope and give you 100 rupees or 10 rupees medicine. No, dentist is very skillful. Lastly, God has given only one mouth. And if you can't chew properly, your whole health is gone. It is not what you eat, which is what you chew. The naturopathy will understand that what you digest is more important than what you eat. And if you don't have teeth, you can't digest yourself.
Yes,
So,
thank you so much. And I'm sure I'll have a couple of surgeons chasing me after today's talk. But a bunch of us, we all believe in it. Yes, yes. And I'm glad. We are all people who are very passionate about what we do. Now, Dr. Abhirami, one question for you. And it says, by altering nutrition and by, looking at some of the available, diet mechanisms, can we genetically alter any gum disease? Do you think that by altering diet, by changing the pattern, that you can alter the genetic composition?
I think that is something beyond it. Like food and genetics, I think we didn't go that far. Science and technology hasn't gone that far. But the thing is, food has a role in preventing lots of dental issues. If we really take care of it, there are lots of methods by which one can prevent it. But into genetics is totally a different thing. That's not possible.
So the question here is, can any nutritional therapy reduce the genetic risk of gum disease?
Genetics is, I don't think that
Can I clarify
anything...
that question, please? Sorry to interrupt.
Yeah. Go ahead, Vimal, go ahead.
Yeah, Abhirami, my question was like, if you know the genetic risk of developing the gum disease, because there's actually 30% rate of genetic predisposition that has been identified for periodontal gum diseases. So if you know that a person has got a very strong family history, can that person undergo kind of a healthy diet or a diet that is suitable for that person and prevent the development of the gum disease rather than managing or treating it?
Okay, I think even there are lots of people who have genetic predisposition for diabetes or whatever, cholesterol, hypercholesterolemia. All these are just factors. And they have more probability of developing. But with proper oral hygiene, if they are really going into a good diet, I think it can be prevented, because genetic is not the only one factor that is coming. When all the other factors do work with it, only then a person is going to develop a disease, whatever it's a oral health or in case of whatever the disease. So I think if we could have a good proper diet and proper oral hygiene and preventive way with dentistry, this can be prevented. It should be prevented.
Yeah. Dr. Abhirami, one more question. It says that I do consume alcohol occasionally. And do you think the mouth becomes acidic after consumption of alcohol? And would you recommend any mouthwash after consumption of alcohol to prevent the mouth from becoming acidic?
See, there are lots of things on moderate consumption, little consumption, and all those things. Definitely, we know that when there is a high consumption, it's going to corrupt the whole system. But mild and moderate thing doesn't have much problem. But of course, it increases the acidity of the saliva. And that can be done by saltwater rinsing. All these things are temporary things. But the thing,
yeah. Okay. Dr. Krishna, what is your take? Yes, Dr. Miker. Yes.
No, why do we say wine and cheese? Because wine is acidic and cheese is alkaline. So if anybody is giving alcohol, they should have cheese. Immediately the saliva pH will balance.
Yeah, cheese is a saliva maker. Cheese is the best saliva maker.
I'm sure all of you are asking me questions on alcohol. Ensure that you carry your own cheese. And afterwards, please don't come back and tell us that we asked you to drink, provided you carry your cheese, right? So that's on a lighter note. Krishna, one question for you. What is your take on adult orthodontics, especially in post-menopausal women? Do you think that it lasts, or do you think that it's just something temporary?
Yeah, like I said, the age is not a limiting factor, provided one has a reasonably healthy bone and the gum tissues are good. We can work on anybody. In fact, in Western countries, the longevity becoming more at the age of 80 and 85, people still go around looking for a job, and there's a compulsion to look good. So adult orthodontics is a big thing, and that's the trend in India as well. So age is not a limiting factor.
Okay, so in a person who's undergoing osteoporosis, Dr. Krishna, will you please recommend ortho treatment, or will you refrain from it?
Yeah, we first have to send them back to the physician to find out what medication they are having and what is the impact of the particular medicine on the porosity of the bone, and certain bisphosphonates which they use, if they can be altered or an alternate drug can be given and the bone made plastic, and there's no, it is not a limiting factor for all.
Okay, okay. Dr. Padmanabhan,
Yes,
what is the most reasonable implant and how much time do you think should elapse between placing an implant and extracting the tooth? Yeah.
Okay.
Is there a solution to place an implant immediately?
Yes, there is a solution. As soon after we remove the tooth, we can place the implant. And in my opinion, that is the best way to place the implant also. The only contraindication is if there is going to be a very severe infection, severe bone loss, we may not be able to place it. But if the extraction is atraumatic and there is no infection, there is absolutely no contraindication as to why one should not place the implant immediately. So immediate placement is the first recommendation from my district.
Great.
The second question is, what is the time elapsed between the placement of the implant and fixing the teeth? The second question.
Yes, yes.
It all depends upon what we call it as the surgical procedure, the primary stability. If this has got nothing to do with the patient, this is the density of the bone that is going to come into play, and the dexterity of the clinician. And if the situation is favorable, we can even place the artificial teeth immediately on the same day, with which you will be able to comfortably bite on. What we call it as an immediate loading. The all-on-4 concept is immediate loading. The minute we fix the implant, maybe 1 to 6 hours or 5 hours from that laboratory time, we are able to fix the teeth and the patient will be able to eat normal diet.
Great. So the one last question that we have, Sangamitra, there's a question which asks you that does cervical spondylitis affect dental health as well, or is it vice versa? If you have a dental problem, do you get cervical spondylitis?
Yes, either way, actually. And we are able to, people, when I see somebody wearing collar, actually, I most times I do walk up to a person and say, come and see me. And most times, actually, those people have gotten rid of their cervical collar with which they walk around. It works fabulously well.
Great. Dr. Miker, one question for you. Having attended this program, first of all, thank you, sir, for the cheese and wine punchline. We also would like to know that being attendees of this program, if you're entitled to a special discount if we visit you in Mumbai.
Yeah, I remove the teeth and replace it very cheap. Removal is free, replacement is not free. Anyway.
Yes, you wanted to share something before we close. Yeah.
I want to say about spondylosis. I was told that I was having spondylosis in 1997, 98. And I visited Tufts University, and when I saw other people were treated for same symptoms like headache, neck pain, shoulder pain, I checked myself and I used the splint, and my headache was gone. So it was not spondylosis. So this is a time that pain clinics all over the country and neurologists should also consider about TMJ and neuromuscular pain, which dentists only can. So even a small replacement or paddy, ortho by orthodontist, all these people can solve the headache, neck pain, shoulder pain, etc. by treating the occlusion. And people should know that the occlusion is very important. And it is said, the last sentence which I would like to say is that interpupillary line should be parallel to the occlusal plane, parallel to the nipple line, parallel to the hip joint, parallel to the knee joint, parallel to the sole. And if I give lecture for 4 or 5 hours, I get a low backache. So one of my Italian colleagues, when we were doing masters, he just folded a cardboard and put it on my heel on the left side. So there was a balance and my low backache stopped. So this balancing of the sole is equal to balancing of the occlusion for the whole body ache for the spine, which people in India still have not understood because we couldn't train them. But the time has come that they should understand that if neurologists and other people can't treat, stop the medicine, think of dentist and specialist, and we can solve the problem by checking the occlusion with all the specialists.
Yes, I would like to add here, sorry to butt in. This is the treatment is without without surgery. So I think we are huge contributor to the health, and not just oral health, overall health.
Yes, thank you. Thank you. One last question, Sandesh, to everybody. Do all of you recommend the use of a mouthwash? Because we've been told otherwise that mouthwashes are responsible for some changes inside the mouth. So as dentists with so much of experience, would you recommend the use of a mouthwash regularly? So we'll just take one sentence from everybody. Padu, do you recommend a mouthwash?
Once a day, yes.
Once a day, yes. Krishna, what about you?
I do especially fluoride mouthwashes for children because if they don't brush well when the braces are on, they'll be prone to decay.
So mouthwashes for children once a day. Padu, Siju, what about you? Would you recommend a mouthwash and what is your prescription?
For everything
for everybody.
They say everything in moderation, including moderation.
Okay, moderation. All right. What about you, Sangamitra? Dr. Sangamitra?
No, I don't recommend mouthwash. It depends, like situation, but on daily basis, I don't recommend. I prefer salt water rinse. I actually prefer everything natural. So I believe that if you use too much of mouthwash, it's an antiseptic, and it actually, the mouth gets adapted to that, and you really require it, doesn't work. So I believe that. And my take is that on regular basis, do more of salt water rinse than going for, mouthwash. Yeah.
And Dr. Sandesh, what is your take on the mouthwash?
Non-alcohol mouthwash, as Sangamitra said, recommended because your normal oral flora, you need it, and go for Ayurvedic mouthwash. And of course, salt water rinse is there, but won't recommend alcohol mouthwash regularly because that is more dryness and more problems. So
great. And what about Dr. Abhirami? What is the best natural mouthwash that you recommend? Is there a combination?
First thing is salt water rinse. And second thing is we recommend there are lots of essential oils like lemongrass, like there are goa leaves, and there are so many things which they can boil and they can make their own mouthwash. These things, I feel that it's if it is a mild problem, most of the things gets corrected by this way, with warm salt water, and this essential oils really helps.
Great. So we need to now close down. Jagdish, are you there? Would you be able to switch on your camera? Jagdish, are you there? Okay. Bimal, could you turn your camera on? We'll just take a nice screenshot. Sandesh, if you're there, just please take your switch on your camera, please. Sandesh, Dr. Sandesh, are you there? Okay. Yes, great. Dr. Bimal and Jagdish, could you please switch on your camera? Are you there? Okay, so Jagdish is not there, I guess. Can we have a smile? Can we have a smile? Everybody say cheese and no wine.
Cheese and no wine. Thank you.
So we've got our screenshots. My heartfelt gratitude to everybody who's been listening to us. It's been a good 2 hours. Time flies when all of us are sharing and we've had great times. I'm sure in real conferences, we die for the dinner coupons and we look for lunch coupons and things like that. But today we had fun. Yes, Sandesh, go ahead.
We forgot one thing, that there is no report in the world that dentists can get COVID in the dental clinic. Neither patient get COVID in dental clinic. So patients are free to go to dental clinics and dentists can work on them.
Yeah, so as many people as possible, please go hug Dr. Sandesh Miker. I'm sure he's carrying a few gifts to give to all of you and he's assuring you that you're not going to get anything. Good to see you, Dr. Prakash. Now the gentleman you see on your screen, he's a doctorate in martial arts. He can knock a couple of teeth in case we need his services.
Yeah,
so,
sure.
On a lighter note, he's just a friend who's dropped in. Jagdish, I don't know where you are, but thank you so much for having arranged everything, sent all of you the emails, helped me with everything that is back end. Our heartfelt condolences to your father. And I'm sure that your mom and your sisters are going to come back home safe and sound. To everyone who's logged on online, I'm sure that all of us, on behalf of every panelist here, thank you very much. And I see that everyone is showing us a thumbs up. They're sending their appreciation. Vimal, as always, great pleasure. You've always been a great support. Good to see you. And Vimal has always been a part of my panel. He's a nutrigenomics guy, and he's a a geneticist who works in a huge place. He plays a very big role and does lots of research. If any of you want any work done, Vimal is a one-stop shop for me because I trust him with everything. Dr. Siju, Dr. Abhirami, Dr. Krishna, Dr. Sangamitra, Dr. Padmanabhan, and Dr. Sandesh. Great sharing. Thank you so much. Please share a lot of feedback. This link is available on YouTube Live. It's always going to be there. So if you feel like sharing it with anybody or like to go back and look at it, please feel free to share it amongst friends and family. Please keep joining us in all our sessions. Write to Ushi at Gmail, WRITETOUSHY. In case you want any further clarifications, you want to reach out, feel free. They're all available on Google. But if you really want help, please write to Ushi. We will send you and we will connect you with the concerned specialist so that you can seek help. You can have a consultation and you can actually go back there and do whatever is professionally right. We cannot prescribe and diagnose online. There are limitations. So from your respective spaces, big thanks on a weekend to all of you and your spouses for allowing you to be here. It's been a great evening. Jagdish, Deepthi, and everybody on the back end, thank you so much. To all my friends who always help me share all of this. This has happened purely through sharing. And to all of you also, thanks for coming by. We gain nothing by this, but when this is all over, I'm sure that we'll realize that we are blessed with a lot. We need very little. And the biggest connection is one human to another. So my heartfelt gratitude to all of you on YouTube, everyone else who's logged in, to all my friends and family. Thank you so much. Thank you. Have a great evening. And yes.
Bye.
Yes, we'll be in touch. Thank you so much.
Thank
you.
Yeah, sure.
Bye.
Thank
Have
you.
A great
Thank
evening,
you so much.
Bye.
Bye.
Bye. No,
Bye,
please.
bye, bye, bye.
Bye.
Thank you, Ushi.
Yeah, love you, Vimal. Bye.
Yeah, bye.
Thanks. Thank you so much. See you soon. Bye.
Bye, bye. I'm trying
Prakash,
to
see you. Bye.
Bye. Thank you. Sorry, I was caught up in something.
Hey, no issues. You
but
can
I just
join
wanted to say hi.
I'm heading to a team meeting right now in Oman.
Okay, sure.
Bye. Bye.
Bye-bye.
How do I leave this here?
Just there's a red mark on the right side corner. Leave meeting. Yeah.
Yeah. Okay. All right. Bye, Ushi. Bye, everybody.
Bye. Jagdish, are you there?